One is related to social life, one is related to school. But where does this problem stem from? I think it comes from a lack of self-esteem, really. I think you are scared that you can't do well on your exams and you're getting this pressure and stress because internally you feel that you don't have the capability to do well on your exams. And why are you feeling displaced in your, psychosocial relationships? It's because you don't feel worthy of a good. You don't feel you are worthy of a healthy friendship. So it all comes from this internal need for validation from something else. Either it's from a mark on an exam, or it can be from another person. Where honestly, your internal validation should come from yourself, which is something that like I said, the form is different, but at the core, it's all about self identity and self esteem.
Thank you, Jolly. Miss Jolly. I definitely want to check the age certificate, Mr. Jolly. Are you carrying it? Okay. You want, Dharmendra, you must ensure that she's under 30. But on a very serious note, I'm saying it's a compliment to you. I have a 15-year-old, so I kind of understand. He's very wise and I like to believe he's very empathetic. I want to ask you, what can the society, parents, schools, because children spend a lot of time in school, do to foster this teenpreneurship, We've got 20 and 20, which is primarily to foster teen entrepreneurship. When I remember my daughter's older, my son is older, she's 19 plus, and she enrolled for a Thai young entrepreneur program at 14. It's when they're not like 14. And it changed her outlook, exposure. She wrote a book at 16. Her confidence is very different. She runs a podcast. She writes a second book. So I know that exposure can really a lot of the confidence. It can change the direction. I know firsthand as a parent. But tell me institutionally, because your parents are entrepreneurs, you got to. But what can we do as schools? Because you spend a lot on schools, your parents, society to foster more entrepreneurship with younger people like you.
So I will be very honest. I think I speak so well and I have so much knowledge because of my exposure and the exposure that my parents and my school have given me.
Which school do you go to?
I go to Pathway School, Gurgaon.
Right.
And I think it all starts with your child coming up to you. Your child comes up to you and tells you, I want to be this or I want to do this. And it all depends on how you react to that very statement. If you say something like, "Arey, ye to bachcha hai," or like you belittle his dreams or his hopes, the first time that person comes and that child comes and tells you, that's when it all stops. And compared to if you encourage them, or if you or if you motivate them, or if you say, "Wonderful, what can I do to help you?" they understand that you want to help them, and they also feel a lot of confidence in themselves, and they want to keep innovating and working towards their goals and dreams. And also, as parents, that's one thing, to never crush your child's hopes and dreams, but also to tell them that it's okay that you don't find your what you want to do in life very early on, or it's one singular thing. Because I think the perception is that we go to school and we study, we go to college, we get a degree, and we do that one degree, we do that one job for the rest of our lives. But that's not true. Our interest, our passion changes with our experience. And we need to assure them that it's okay if one day you want to be the best skater in the world and the next day you want to run a multi-million-dollar business. It's completely fine. Now, speaking from the perspective of schools, I think a school plays a crucial role in instilling that voice and choice or autonomy in their students. So, for a student to be able to come up to the school and even do something as little as raise a concern without fear can, foster a culture of connection, can foster a culture of innovation because they feel brave to point out a problem. And it's up to the school to kind of motivate them to keep on taking action. So in my school, we had a lot of these little programs. We were asked to kind of pick up an SDG, create a project, and kids really really love that. I think it not only shows them their like capability to do great things, but it also helps them explore other streams that maybe they weren't that interested in, but after they did, it opened up a new perspective for them. So
Absolutely, I agree with you. I agree that the best thing parents can do is to build on the self-esteem of their children, give them positive story, encourage them. And whatever you say to your children, they become that. If you tell your children you are a dud, there's a good chance the person, I mean, I'm saying it as a, or if you encourage someone that you can do something, more often than not, they'll be able to do it because you instill this faith in them that they can do it. So I think that's the role of parenting. I see your dad taking video. I do for my daughter. Right now she's in the US, but she's in India. My last question to you: how has this process transformed you? What is in this, let's say, 9 to 15 journey? What has happened to you in the process? Of course, you were very confident at 15. You speak well. You raised capital. You were building. Beyond that, what has transformed inside you?
So I feel that, apart from just being able to speak well and having more confidence, it's also made me more principled because I think, with power, with platform comes responsibility. And, to be able to carry that responsibility at a young age has taught me how important it is to remain principled in every aspect of your life. And this is something that, you can bring in your life or your child's life through simple everyday steps. Every day, I have a night routine every single day. And that's helped me bring order into somewhat of a chaotic life where I'm going to school, I'm going to work, but I have to have a night routine.
You're in class 10.
Class 10.
Your board exam.
Yes.
Sorry to remind you.
No problem.
My son is in the same class. Why?
Yeah, so just doing little things to establish that, sense of like routine, that sense of having control over your time and your 24 hours. That's how it's changed me as a person.
And what is the ambition? As you said, it takes time, it will take, it's still very formative. You're experiencing ideas and streams. I understand, as I said, what my children have gone through this. So, what is the ambition as of today?
My ambition as of today is to ensure that every adolescent in the world, every person actually, has access to the right kind of healthcare. And by that I mean specifically, I work on mental health care. Mental health care is supposed to be a right, not a privilege. And that's what I want to change in the world because of how inaccessible it is, because of how inaffordable it is. It's getting harder and harder for people to go see a therapist and talk to a therapist. And also, there's a lot of stigma, there's a lot of shame that we don't even realize exists. Like for us, maybe it might not exist for the people in this room, but there is a lot of stigma for just a normal person who works at a bank who's starting to experience symptoms of anxiety and they don't know what to do and they feel ashamed going to a psychiatrist because people will think they're crazy.
So what are the top 3 things that give anxiety to, say, children between 12 to 15 from what you experience? What are the top 3 things?
Top 3 things I think would be academics.
Why do you take
Academics.
that? Because anxiety is a parent.
Right. And also that expectations from teachers, parents, superior figures. And I would say, yes, a lot of anxiety comes from your social relationships as well with your friends in your social circle. So I think those three aspects.
Fantastic. You have Mr. Rishka Jolly for you. Give you a big round of applause.
Thank you.
Certainly, when you grow up, I want to be like you. I want to grow up at 15. I think what you achieved is remarkable in terms of thought process and clarity of articulation. Must compliment you on that.
Thank you.
Any questions for Anushka? Anybody wants to donate to our app?
We have a question. Can we please have the mic for him, please?
Firstly, I think really inspiring the kind of work that you've done at such a young age.
Thank you.
I had a question about students in Kota who prepare for exams, and we're increasingly hearing about suicides because of expectations. It's also happening to students once they get into prestigious colleges like IIT. How do you think your approach could be extended to them? Is there a way that there could be institutional partnerships that could help us?
So I want to link this back to the initial conversation we were having about the 3 Ps of healthcare. So that's where I think preventive really plays a role. Why do we let the state of mind of these adolescents get to that place where they feel the need to, die by suicide? I think it's important that we prevent that before it gets to that stage. And I'm working on that by using my second and third versions of Kavach. So a little bit about what I'm doing. The second version of Kavach is going to be an app which has a lot of positive self-help content, which can help an adolescent if they're going through any issue like whatsoever, whether it's exam stress or anxiety or anything, any questions that they have. That app is for them, and they can also talk to other adolescents who are going through the same issue, because I feel that community support is a very important and defining factor when you're going through an issue, to feel more accompanied in your struggles. And apart from that, the first mental health metaverse that I spoke about earlier, that is going to provide them with anonymity when they're seeking counseling. So a counselor and a patient, they both get into the metaverse as avatars that they can design. So they have power over how they look and how they present themselves. They're sitting in a room and they're doing this counseling for 1 hour. And this is going to, first of all, make it more accessible, because this app, Kavach 3.0, like Web 3.0, is available on any technological device, on a phone, on a laptop, on an Oculus, anything. Second of all, it's more affordable because it's cutting a lot of costs that otherwise would be there for both sides. And lastly, it's providing them with anonymity and removing that entire layer of stigma and shame that is associated with seeking help. Also, I was just reading up about the statistics yesterday, and I found out that according to WHO, there are about 0.3 psychiatrists per 1 lakh people in India, whereas there should be 3 psychiatrists per 1 lakh people. So my app also fills that huge gap, because one psychiatrist can answer and talk to more people in 1 day. So that's going to fill a huge gap in the market. And I think using my app, hopefully I can take it to Kota. I've been having a lot of meetings. I just met with Niti Aayog, and hopefully I'll be meeting with the IS officer who's in charge of that area. And we will be discussing how we can implement Kavach 2.0 and Kavach 3.0 to give or provide preventive care to these adolescents, to these people preparing for exams in Kota, so that it doesn't get to that stage of mental anguish where they feel the need to commit or die by suicide. I think it's, yeah.
I didn't go to an IIT. I didn't go to an IIT. I did okay. I think we need to bring out these stories of one that academic excellence is good, nothing against that. I'm everything for it, but I think whatever you want to pursue, as Confucius said, make your hobby your profession. If you like music, you're a good sport person, whatever, it's okay. I will never My parents are academicians and never say that, excellence in academics is not good. But I think normalizing excellence in other areas apart from academics is a big part of it. Second is highlighting the stories of people who didn't make it to IIT but still did okay. I think these are things. Anushka, my only advice is do something on the ground. Of course, online is good because scalability and young people spend a lot of time there. So it's good you're catching them there. But do a lot of face to face. I think that's my advice to you. And I understand this space fairly deeply. So we have another panel coming up. We're already running late. Please give the story.
Loud cheers, ladies and gentlemen.
If they can have happy solutions to whatever queries they have, I think they'll become better individuals and better adults. So what you are doing has a huge impact. Keep doing it well and keep making it well. Thank you.
Thank you, sir.
Wonderful. Thank you so much, Anushka. Thank you so much, sir. Time for the photo. And Anushka, genuinely inspiring story. 15 years, 50 lakhs. I think the only 50 that I know was the 50 glasses I had broken by then when I was playing cricket. Getting bashed by neighborhood daily. Really inspiring. So moving on now, we are getting set for the next session. Are we ready? Do I have a heads up, Sanjana? We need some time. You ready? Wonderful. So the next session, it's a fireside chat, ladies and gentlemen. It is about a very important topic called data protection and privacy. The subject is data protection in healthcare, of course, today that we're talking about healthcare. With the newer technologies also comes the risk of data leak and privacy. This conversation is about two founders who will be talking about the need of stringent data protection measures and what is actually happening in the healthcare ecosystem. To moderate this session, may I please call upon stage Shivam Tyagi, editorial lead, BW Healthcare World, on stage, please. Do we have Shivam over here? Thank you, Shivam, for joining us. To join him, we have Viren Agarwal, COO, My Digi Records. He'll be joining on stage, and he'll be also joined on virtually by Harsh Parekh, co-founder, Briefcase. Do we have Harsh over here as well? Hi, Harsh. Hi. So, are we ready? All set? Perfect. Good to go.
Thank you. And uh, my Digi Records as well. Yeah, it's correct. A day of LTech cannot go without discussion about data, right? And in the really fast private entities, let's say hospitals, everybody's gathering your data. Uh, working with the smart devices. But as we're speaking, your pulses are getting recorded, everything is getting recorded. So the laws around that, protection around that, the issue of privacy around that is what we're here to discuss. I want to start with Mr. Parekh. So Parekh, tell us what is the need of data protection in today's day and age?
Sure. Um, so the way we look at it, data protection involves two aspects. There is privacy and then there is security. While security, of course, is as important as other, I'm going to talk more on the privacy angles because there is where we think a lot more work needs to be done than is being done so far. The most important one being that today, especially in the health tech world, there is a need for transparency as to how healthcare entities are operating and using data. Because the sensitivity involved in the kind of data, the kind of information that some of these entities sit on is immense. The previous session talked about mental health. Now, one of the biggest problems that mental health faces as a challenge today is that people don't want others to know if they're seeing a therapist or a psychiatrist. They and that applies to several other therapeutic areas as well. Reproductive health, in case of children, parents don't want others to know what treatments are going on. So it is extremely important this kind of information is well protected. Uh, what we have seen also is that a lot of entities, their monetization models are often questionable, especially so in the startup world, where the need to lower the cost of acquisition, the cost of sales, has often led to abuse of the data that these entities collect. And therefore, the need to have laws and processes in place for its protection is immense.
Right. So the safety nets around it, right? We in the monsoon session of the Parliament recently, we had the digital personal data protection bill, which was passed. And Mr. Agarwal, now I want to understand from you what are those safety nets do we have at this point in time, and are they enough? Are they enough?
So the Digital Personal Data Protection Act lays down and provides a framework that needs to be followed in order to maintain a lawful manner and empower the patient to have the right to data principle. However, due to the broad number of this nature of the Act, several exemptions need to be granted, and it will take time before it is there on a widespread.
Right. So, Mr. Parekh, so what we are hearing with this digital data protection bill is that we, as in the consumers, the whose data is being recorded, we are the data with the principals. We are actually in hold of that data. We will give consents to hospitals. We will give consents to anybody who is trying to take our data. That consent has to be taken. And now, also, we saw recent breaches. There was a recent breach which happened, and all these breaches are not new. And healthcare sector is, reports say it is the most targeted one at this point in time when it comes to breaches. So, what are the, according to you, what are the prevalent loopholes?
Sure. So, again, in terms of security, the breaches that you're referring to, yes, it's going to be an evolutionary process because if the best and the best of the systems in the world have been hacked in the past, so can we ever become hack-proof? The answer is no. But we can always be ahead of the game. Minimum standards can be laid down for the protection of the data which the data fiduciary sits on as per the DPDP Act. In terms of the loopholes, yes, the current DPDP Act, there are a lot of exemptions. And what I personally hope is that when the board is constituted and the board start laying down the more detailed rules, currently the Act is more of a enabling framework, as Viren put it. And it's the board that will come out with the rules that will lay down a lot of the nuances. So it will be very important for the board to put in a lot of details as to how the consent has to be taken, for example. A simple example I can give you and the panel right now is that of the business of prescription audits, where a lot of data is collected from chemists and doctors who are actually data fiduciaries themselves. They are not data principals. And yet that data is collected by companies, which is aggregated and eventually sold to pharma companies for the purposes of their sales and marketing research. How is it that consent is taken in this? Is even in the current law frame, it's a gray area. The current data protection bill actually does not talk about it in a lot of detail, and I'm hoping that nuances like these can be ironed out as the board takes shape. Similarly, there is an exemption in the DPDP Act again on that the Act does not apply where data is collected for research and statistics. But going back to the problem I mentioned earlier, the scope, the word research and statistics are such wide in their ambit that it would also include statistics for the purpose of sales and marketing. And that would, is that something that are patients okay with? I mean, I would be perfectly okay if my COVID data, speaking for myself, is used for the creation of better governance policies or for better subsidies in healthcare. But am I okay for it to be created for creating a sales plan for Sun Pharma? I'm not sure. So a lot of these need to be ironed out. There are also exemptions for startups. But what kind of exemptions? One needs to be wait and see how these details come out.
Right. At this point in time, the compliance also is what critics are saying, that the compliance to the law might be a challenge, because the hospitals and they have to they have to make their cybersecurity systems very robust. Their frameworks have to be very strong. They have to appoint data officers. They have to do regular audits and assessments of these programs. So all this, the hospitals will see them actually as a cost, right? And how do you think this compliance issue can be solved?
So it will take time. It's obviously not going to happen within, say, a month or two or so. There will be, I hope, a phased timeline. There has been recent talk of how the phase is going to be. But to be very, in our view, we think this is a necessary cost because we've already seen what free services online cost us, right? I mean, people want to use Google for free, people want to use Google Chrome for free, but then they have problems when they have intrusive ads. You have to pay for a service for it to give you that privacy. So yes, the cost of these compliances will eventually be passed on to patients, but I think it is a necessary cost that they will have to bear for the safety of that data.
Now, again, those guidelines and regulation might help. Would you like to add?
There's also a lack of standardized security among the healthcare sector, where if you see, all of them are working in fragments. The entire healthcare system, all the providers, facilities are working in silos. So there is no standard of record that is set amongst all of them. Everyone is recording records at a different level at different places. But there's no set interoperability where a particular person's data is being standardized. So that is another thing that really needs to come in line when we talk about the DPDPA. These things really have to come in point where if I am the owner of the data, I give access and grant permission to my of my data to be accessed by the healthcare provider. Up until now, today, even if I have digital healthcare, I am not aware what and how and why I'm sharing my data and what is getting utilized. So it is very important that education and that awareness is also being given to the patient about the healthcare. That what kind of healthcare data has been stored and how it is stored. That transparency has to be there.
Right, absolutely. I mean, you can have loss, but awareness is what will actually bring progress.
Just one point I'd like to add there. Sorry for that, Shyam.
Sure.
From the terms of consent, something that we are very excited to see how the DPDP Act also merges into the framework of the ABDM, the Ayushman Bharat Digital Mission, because the ABDM is already laying the groundwork for patient side consent to be given for movement of health data. So how the detailed nuances of the act, how the two operate together, it will be a wonderful framework in place. because ABDM is actually doing that. If a doctor sitting in Manipal Hospital wants to access a report that SRL has generated for me, they are able to do that with a PHR app that the patient can give consent for.
Right. The government is already taking steps into that interoperability kind of issue that we're talking about here with the ABDM, and more private entities we are saying that they are getting enrolled under ABDM. Now, both of your companies are managing healthcare records of people, of your subscribers. What are the safety nets that you guys are using? Let's start with you.
So we are definitely ISO 2700. We are taking necessary steps where all the data is encrypted, saved securely on a cloud, and at all times we make sure that the data is with the consumer. Rather than staying with us or a provider, the data stays with the consumer at all times. Today, even if the consumer is in a remote area where there's no network, the consumer will still be able to access his data, still be able to upload his data as well and share it. So we're making sure that the data is always at the consumer end, because rightfully the consumer is the first and the only owner of his data.
Right. Mr. Parekh?
Everything that Viren said, plus on top of that, we are also ABDM compliant. We are, Briefcase is one of the first apps to be compliant with the ABDM. And as part of that compliance, we are required to undergo a VAPT testing guideline that is laid down by the NHA, and we undergo those tests on an annual basis.
Right. I would like to take your closing comments on this topic, which is data protection, and how, going along, we obviously need guidelines after the digital protection bill. But how do you see, the privacy issue and the data protection issue going forward? Yeah.
We are moving forward towards a future where healthcare outcomes see improvement in individuals at an individual level, regional, national, and global. Enabled by technology, the widespread of smartphone is leading into an era of information technology, and we are prepared to embrace the wave of empowering individuals to take charge and empower themselves with their own health record and of their loved ones.
Right. Mr. Parekh, what solutions are you looking forward to going forward in data protection and privacy?
I think both the DPDP Act and the spread and increased usage of the ABDM, both put together, will actually put the patient back in control of her health data. The ABDM network, as we know, empowers the patient to a point where the patient can actually decide who gets or does not get access to his or her health data, and fiduciaries cannot on their own move health data as they feel like. Some of these steps, along with the right framework that the DPDP board will put in, I think will take India from being, I think, a few milestones behind the West. I think they can actually put us right in front of them.
Right. Also, just one last question that I wanted to ask. At this point in time, with the current laws that we have around data protection, earlier it was IT law which was ruling data protection. Now we have the Data Protection Act. Are we kind of at par with the West when it comes to GDPR or HIPAA compliant laws which are there? With this current law, are we at par? What are your views?
It's a little early to say, because as I said that the initial enabling framework is on. I think the more nuanced rules regarding the operations of the healthcare different entities, how hospital data versus insurance companies versus health tech startups, how they should operate, those nuances are yet to come out. so it will be a little early to say. But at least given our experience of the current dispensation, having worked with the NHA extensively over the last 3 years, whatever has been coming out of the government's tables has been, if not ahead of the game, at par with standards we see abroad.
Would you like to add?
So everything Harsh said. Along with that, today we are at an advantage where US is still burning 900 million annually in just medical waste. So we have a very good advantage to learn from the West and not make the same mistakes in India. And we can be setting examples, just like UPI. UPI today in India is, I guess, worldwide, is the fastest payment method. It's developed in India during the COVID time, and today learning from the West, where how they have wasted so much time in medical wastage, we can adopt much better measures and make India much successful ahead.
Well, on that positive note, thank you everyone for joining us on this session. Thank you, Mr. Parik and Mr. Agarwal, for joining us here and talking about the biggest topic, which is data protection today. Thank you.
Thank you so much. Can we please have the group photo? Request Harsh to stay as well for the photo. Thank you so much. We'll just quickly set up the panel for the next and the final panel discussion before lunch. I know we all are very hungry, so just one session before lunch and then we can go ahead with the food part. In the meantime, I'll just quickly announce our supporting partners. Are we ready? BW Festival of Health Tech, organized by BW Businessworld, associate partners AliveCore, Tata MD, Lupin Digital Health, support partner Life Science, event partners Joy Travels Private Limited, Fandrum, Beanley Coffee, Jazbat.ai, The Thick Shake Factory, Reality Plus, Exchange for Media, IWM Buzz, Impact, and Pitch. We're all set for the final panel discussion before lunch. The topic for the moment is AI, an evolution of 4 Ps of patient outcome. To moderate this, may I please call Dhanushya Sri Ramesh, co-founder and COO, Neurostellar Private Limited, on stage, please. Cheers, ladies and gentlemen, please. She's coming up on stage. Thank you so much. She'll be joined on stage by Dr. Professor U.S. Vishal Rao, Director, Head Neck Surgical Oncology and Robotic Surgery, and Dean, Center of Academics and Research, Healthcare Global HCG Cancer Center. Welcome, sir. Namaste. We also have Rajesh Khanna, CBO, Lupin Digital Health, and Siva Teja Kakileti, Director, Principal Research Scientist, Founding Team Member, Niramai Health Analytics. We are waiting for, yeah. So the panel is set, our speakers are ready, and I guess we are good to go. So the stage is all yours. Thank you so much.
Hello, everybody. So it's an exciting topic altogether because AI has now become a buzz, and we have an esteemed panelists from different domains in healthcare to address the patient outcome that comes with the 4 Ps that we have been discussing from morning, which is prevention, precision, and all the other 2 Ps as well. So with respect to that, I would like to start the discussion with respect to how AI has been impacting the patient and the healthcare industry altogether. I would like to go with Dr. Vishal and Shiva, where early detection has proven to help with cancer metastasis as well. And also there have been tests and screening that has been happening with respect to precancerous biomarkers that are coming up as well. So how do you think AI will play a role in cancer detection, prevention, and also how's the precision as of now? Over to you guys.
Thank you. Hello. Thank you. Yeah. Very good afternoon to all of you. I think at the outset, what I would like to share is that AI, when we talk about today, I think somewhere we have done a little bit of jumping of the gun in terms of overuse of technology. And I'll say that today industry is at 4.0, web is at 3.0, health is still struggling to come to 2.0. We have still not reached there. And AI is, while it's a hot topic and everybody wants to use the word AI somewhere into the discussion, I think the biggest impediment to the solutions that we are facing in India today is data reliability. I think we are not addressing the elephant in the room, that is data reliability, which is where I'm sitting with the state government and the federal government. And the biggest roadblock I see is data reliability to create a reliable algorithm. Now, this comes from clinical parameters, this can come from bioinformatics, it can come from various other parameters, but India is poor on data measurements from patient outcomes and longevity, I would say longitudinal data monitoring. So until this is sorted out, we have small data, we have good hypothesis, but we've not come out with substantial solutions because of large big data analytics, which are giving us certain noise. And I'm working with multiple groups now, some of the latest groups that are using pharmacological data. Just to give you an example, there's a US group that was looking at creating new molecules for drug discovery using artificial intelligence algorithms and language processing models. And while they were doing that, they discovered about 1,000 new poisons which have never been heard before. Now, the question that we come out in this kind of a context is, now everybody, while they were applauding them and saying that yes, this is a breakthrough, 1,000 new poisons that have not been heard before has been now open to the market, and those have certain implications to the society, certain implications to the crime world. The medicinal impact of it is minuscule. So yes, there are technologies, and so Karnataka has taken up certain steps. I'm at least, we are in the initial stage. So as a part of the vision group for biotechnology, I can say that from government of Karnataka, we are trying to create an AI policy framework for health in Karnataka. And that's our first draft that's initially in discussion right now. But we want to move towards understanding how can we accelerate AI, how can we build and improve the AI data reliability, and then start problem solving with good hypothesis, small solutions. This is where we are currently in this area. Having said that, AI is being used very actively in bioinformatics. Very actively. AI is being used in imaging, in cancer screening. Like I know of groups either in cervical cancer, breast or oral cancers who are trying to use image analytics for AI. We have radiomics today. That means a combination of, for people who are not aware about radiomics, earlier what we used to do when we want to find a disease, we take a biopsy in cancer, we find out what kind of a cancer it is. That means a pathologist takes the tumor, slices it, puts it under certain colors, and then after that magnifies it and sees it under a microscope. Today, what they are saying is just by seeing the CT scan and zooming it in like a smartphone where you're zooming your camera photo, you can have more than 176 features of a cell that can be described using voxels, using Harlick features, using various other combinations. That much amount of evolution has happened with regarding to the understanding of radiomics, and AI added to it is giving a big leapfrog to understanding what biology diseases, what is the biological behavior, including what is the genetic signatures. So yes, potential phenomenal, great area. We all should be focusing on it right now, but I think with some frameworks and maybe putting some priorities in place. Thank you.
Over to you.
Can you hear me? So just to add what Dr. Vishal Rao sir has mentioned, I think he brought in important aspects of data reliability and radiomics. If you see, for AI models, it's all about garbage in is garbage out. If you don't train the model, right, with accurate data, what the AI models which we deploy might not be accurate. So especially in terms of cancer, right, no imaging modality is 100% accurate. So if you rely directly on one imaging modality output, you might have a good modality. You might not have good results when you really deploy it, right? So at Mirama, what we try to do to solve those cases is that, as Dr. Vishal Rao mentioned, histopathology or biopsy is the ultimate ground truth what we can get. So we try to ensure how we can rely on the data. So the veracity of the data is very important there. So as a startups working in the cancer AI space, right, it's important that we worry about what is the ground truth we are using in order to tell whether there's a cancer or not, in order to predict what is the chance of malignancy. Another point also is radiomics, right? It is not simply sufficient, right, to say whether the person is cancer or not. That won't help the doctor at all. It's important that doctor is able to understand. So present the doctor with some of the radiomic features, which doctor can correlate and then understand why the algorithm is saying, this person is having some kind of cancer. I think both what Dr. Vishal Rao sir had mentioned, right? I think those are very good points.
I just like to add two examples to what you said. I was interacting with an AI group that does work on imaging, and very interestingly, they were able to show, in comparison with US, their model worked better. The Indian model was working better than the US model. When they tested it, same on the Indian group. Now, what was interesting was this was about a simple chest X-ray for tuberculosis. I'm talking not about a big complex thing. Or look at this particular example. Now, what this Indian group did was they homogenized. They took 2 lakh X-rays of simple tuberculosis chest X-rays and studied the AI model and built it on training for exposure. That means in a village in Tumkur, the exposure is going to be different. In Bengaluru district, the exposure of a digital X-ray is going to be different. And somewhere in between in Gulbarga, the exposure may be different in a standard analog X-ray, which is used a scanner. Now, between the three, they've made multiple models like this and they created a very unique model with a sensitivity of 90%.
Check.
An American one came competing with them and they had, on the best X-rays, finest qualities, and they had accuracy which is also 90%. But when they tested on Indian patient, the accuracy dropped down to 70. That's one area. And the second thing I think which all of us here should know is there are 4 stages of AI, And if you're looking at today, we are like what you said, garbage in, garbage out. We are at the master slave system, the artificial general intelligence, Alexa, Siri. We are going to move towards limited memory AI. Elon Musk has already done it with driverless cars. I went some time back to San Francisco. I saw where I had ordered in the receptionist, the robot came to take the order. Then I had the driverless car to take me to the robotic center. So it was a different kind of a world. That is limited memory AI. That's already started in. Now, what Stephen Hawking was worried about was that if you reach theory of mind or if you reach self-aware AI, is the danger begins. And he said, someday we will begin. And I'm remembering my lecture in 2019 when I was giving at Mumbai at the Tata Institute, where I was saying 10 years from now, maybe we'll reach there because army is already having this. And while I was talking that 2022 July, Lemoyne has been put on gardening leave from Google for cracking theory of mind. So which means that I think we are not talking about a distant future. We are talking about tomorrow, day after tomorrow, some disruption may happen which we will not be aware about. So I think we all need to be aware about the fact that disruption is going to happen much sooner than we're going to imagine now in the coming days. And I think it's for all of us here to keep a watch out on who's going to be which corner is that disruption going to come from.
But the question with respect to what you said about the disruption is that you rightly mentioned that healthcare is at the maybe 1.0 to 2 and not at 3 or 4. So how can we accelerate, or how do we do that is with accuracy, as you had mentioned, and the reliability of the data, and also the amount of data that we collect as well. So moving on to the next question that I would want Mr. Rajesh Khanna to answer is on the Hello? Yeah. So in India and also worldwide, cardiac disorders has been one of the top killers. And also nowadays we're seeing 25-year-old and even recently a 26-year-old who was walking on a treadmill just had a heart attack. And it is like very shocking to know this. So does AI have a role in prevention and also with respect to the prediction of such things that are happening? And how can we accurately monitor? There are different variables and things that are coming up. Like how do we do that?
Great question.
I think we are dealing with a disease which does not just affect an individual, but when it occurs, it affects the whole family. Even the cancer which we were talking, it's about a family. I mean, I have experienced that. So it's the family which gets derailed when something like this happens. And these diseases are occurring to us at a much younger age than we used to hear earlier. Like all of us would have come across a case where the person who had a cardiac event, is in his 30s, mid 30s, less than 40, less than 50, very healthy individual, the one you were talking about, someone on treadmill just had a kind of cardiac failure. So what actually probably the digital or technology or AI can help is, of course, prediction, but predictive models are yet to evolve in cardiology space especially. But prevention and personalization, the 4 Ps that we are talking here, prevention and personalization, yes, we are there. These tools, I mean, also offer great advantage of accessibility at an affordable price. Let me talk about Lupin Digital Health. At Lupin Digital Health, we have created some cardiac rehab programs, which we run over a digital platform. We call these programs as digital or remote cardiac rehab programs. Patients who have had a heart attack or who have high risk of getting an event, or even patients suffering from heart failure, where rehab is a class 1A recommendation. And doc, you definitely you understand what is class 1A recommendation, but we hardly see that being applied or being in practice in the country today because of lack of experts or qualified expertise in this domain. Hospitals do have intention of running these rehab programs in their centers, but then patient has their own problems, the logistic issue or multiple visits to the hospital, something as a challenge. So that's where we felt the digital technology can definitely solve a certain aspect of it. And we also try to address another perennial problem. Whenever there is a digital or technology being spoken, the first question comes to a doctor or a clinician is, are you taking or are you talking about taking away my patient? So we have kept the doctor in the center, at the center of the entire process. We have kept the hospitals as a part of it, and then we run these programs as a digital or remote model. What happens here? The first step for any of such programs is assessment, what we call it. So it's the awareness it all starts from. So the health coach must have complete awareness or understanding about this particular individual or the user. Same way, the patient or the user must understand where exactly is he in that disease continuum. And by having this awareness of education, how he can actually work towards bringing some behavioral changes. In the morning, we were talking about incentivizing or having rewards to people to change or bring those positive behavioral changes. We will talk about it. But then this is how we start. We start from the awareness level, and then we advance from there in getting them implemented. We tailor, we personalize, we customize to the vernacular language of the patient, so that we can have accessibility. A rural patient or like a Kannada patient, probably in Aster Hospital today, may get a coach who is talking in Kannada or Hindi or English there, but if the patient is a Bengali patient sitting in Aster Hospital, having Bengali dietitian probably would give them better understanding about their food habits, right? So we try to give them in a vernacular language. WhatsApp is another model which we have applied so that people, the most used application today on the globe, people can actually, so our platform is integrated with WhatsApp, so people can chat or interact with over WhatsApp. And there is always the entire qualified experts, right? From a physiotherapist or a cardiotherapist, what we call, a cardiac nurse, a health coach, and also the doctor and the team who have the access to monitor this patient's health. So between two visits is where the event needs to be prevented, right? Today I am in a hospital, I got my prescription, I got my discharge summary ready, and doctor said you have to come to me after 90 days. What happens in these 90 days is actually these progressive disorders like diabetes, cardiac illness, is what we are trying to monitor the patient for. And while doing this, we are able to prevent someone getting hospitalized because we are able to detect some off-range vitals very early. We get the patient connected instantly to the expert, and then the treatment or the guidance is offered. Second thing that is also happening is prevention of an event. We also see trend line of these vital recordings. Patient is registering his vitals on a regular basis. Whenever there is a off range and it is becoming a trend line, like there is a pattern, regularly last 3 or 4 vital punches have been off the range as suggested by the doctor. We reach out to the patient and then bring the patient back to the doctor. So doctor also wants to take a timely, do a timely intervention or do an informed decision. So we provide both the things to the clinician. We provide him with the data, and we also provide the patient at the right time where he can prevent. So definitely the technology has got a role to play. Prediction is something which we definitely want to work for. Even how can we say, like one of the recent challenge which was thrown by one of the cardiologists, he gave us a few hundreds of ECGs and asked us to identify the gender and the age of the patient just going through the ECG, right? Our data scientists could do that to an accuracy of 85%, right? If the same ECG for an individual, the next challenge that we are looking at or thinking about is, if my ECG at the age of 20, 25, 30, 35, 40 is available, can then AI predict at what age someone can get into a kind of cardiac event? So I think immense potential, but yes, we have already begun that. Yeah.
So, as you had mentioned about the healthcare and the industry that is associated, so Lupin is doing with patient with illness. So, as of now, but when we take it into a general wellness perspective, I would like to get your views on how AI in preventative wellness is being transcribed. As we can see, the emergence of wearables and many other screening and imaging techniques that are evolving and that has been easily available to the patients in their hands, starting from an Apple Watch to measuring heart rate variability with just the sensors in the camera and all those things emerging. How do you see the preventative wellness space transforming? It's an open question to all the three of you.
I have been inside the hall since 10, and I got 3 nudges since morning. You haven't walked, it's time to take steps, it's time to flex your muscles, right? So I think this is what wellness is all about. How disciplined are we towards various, we all say that we know that there is a limit on what we eat. There is a stipulated amount of exercise that we are all supposed to do. There is also amount of sleep that we are supposed to take, but then we are also ambitious professionals, aggressive executives. Many times these are all, for some, this sleep is also a luxury today, right? But are we aware of it? I met a patient who was recommended a program by a cardiologist. This individual is 33-year-old in a senior leadership position in one of the leading software firms. Weight 58 kg, 5.8 is the height. So BMI is green, dark green. No diabetes, no hypertension, and then he had an event heart attack. So doctor definitely said yes. This is something has happened, but he was fortunate. He was brought to the hospital within 30-40 minutes of the chest pain, and he was, treated then and there. Post discharge is where we met. The moment I met him, I asked him, "Sir, who is the patient in the home?" And he said, "I am the patient." I said, "You look fitter than me, better than me. How come you are the patient?" Then he explains, "I play 45 minutes of badminton every day, right? And every Saturday, Sunday, I also go for cycling, 20 to 30 kilometers weekend." And I asked, "What changed? Then why are you in this situation? What went wrong? Family history, parents diabetic, parents hypertensive. No, one of the parent is hypertensive, but no such event till then. Then he talked about something which is very, very important. He said, Khanna Sahab, last 2 months I have been working on a very big project of mine. It's a 36 crore project for me and my team. And last 1.5 months, I have been sleeping only for 2-3 hours. And there the answer lies. He has a wearable device. It tells him every often. But what we do not probably use our wearables is for our sleep timing. Probably exercise, everything is there, but sleep is something which we do not train our wearables for. So if sleep is something, so sleep has entered as one of the primary risk factors as per ACC 2022, American Health Cardiology, as one of the primary risk factors for a cardiac ailment. Yeah.
No, very valid points, Rajesh, and I think I'll take it from there. I think the fundamental point he's trying to again allude to is that if you're fit, you're not healthy. I think it's the bottom line, and I think I've time and again seen that in every context, in various examples like what you quoted. That if you're fit doesn't mean you're healthy. You see n number of people who say I'm a teetotaler, I don't do this. Why am I getting a heart attack, a cancer, or this? And various factors, sleep is one among them, but there are still people in who sleep very well but yet get a heart attack. I'm just saying. So I think the overall thing, we don't know the final parameter, but we know that if you're fit, need not mean you're healthy. Okay. I also counter the argument that stress is a factor, because I keep telling people stress is a healer. So for example, when we were going through COVID, we were betting inside my operating lounge that I'll have at least 2 stents, because everybody thought I should be, the currently considering that I was sitting on 2 government committees, driving this, looking at the hospital, managing this. They said at least 8 block to Rega. So I went for a preventive checkup. They said nothing is there. So I said, okay, still I can go on for some time. But the question was, again, reiterating to the fact that stress also can give out good hormones like endorphins, oxytocin. So it's wrong that stress is bad, because I keep hearing this IT crowd keep coming and telling me, oh, you know what, I'm stressed. I mean, I told them, imagine what my stress must be. If you're having 4 surgeries, 6 surgeries, 12 hours of working, plus after that OPD and plus rounds.
But you enjoy doing this.
That's why the 30 crore target is the problem. I mean, I'm saying that, no, but in the end of it, I think the world is moving towards what is called as a health span, not a lifespan. And I think that's where the next generation focus will be. The next 10 years focus will be on health span and not on lifespan. And the one single area of preventive which is going to change the game is going to be diet, which is going to have all of this incorporated. I'll just take a minute to tell you all the biggest breakthrough that I'm seeing currently today, and we are hosting Bengaluru's Tech Summit in November, is the microbiome. Microbiome, we are all here sitting with 30,000 genes. That's what we humans have. But those 30,000 genes are controlled by the 2 crore genes which are inside our gut, which control our entire system. So your sleep pattern also I can tell based on the gut analysis. So today, if you look at military and other things, some of the UN meetings I've attended, people carry their own toilets because they don't want anybody to analyze their gut microbes. They can know every single thing about you, including predictive analysis about what diseases are going to come 10 years from now to you. That's the level of bioinformatics we have. Similarly, in ECG, we are having a lot of thing on heart rate variability to predict and plan diseases. So I think a conglomerate data will come up soon of creating a person's Janam Kundli or his health Kundli, whatever. And I think health span is going to be the focus in that. And again, it's going to come back to data reliability. And preventive is going to be a much, much bigger space than illness. It's going to be wellness that's going to be taking over. How far are we going to be able to predict some of these? We don't know. But I think it seems very promising as of now, and I think I would put my bet into prevention. I would definitely put my bet, and the data that I have in oncology, in microbiome, is phenomenal to understand what that person eats, what illnesses he's prone for, what amount of serotonin, dopamine, acetates, sulfides are getting released, what impact it has on the brain, what impact it has on the immune system, heart, everything is being decided in the gut. So we've been playing with some of these data to understand in a preventive mode to understand what can we do. And one of the things that we're introducing hopefully next month is the fecal microbial transplant. So if I come to know from your gut microbe that you have a dysbiotic gut which is prone for various diseases, I'm going to take the fecus of a normal individual, sterilize it, purify it, and then give it to you as a capsule, like a supplement. You'll not even know, but that has got more curative powers than any of the other interventions you're going to do. And this is what we are currently working on. And I'm saying this is a whole interesting game for us for the future. I'll only add one quick other point with regarding to data sharing. Government of Karnataka has taken up another very good step. If any of you all have heard about Red Cat, Vanderbilt University started it. We started working with them during the COVID. So they had a very beautiful data platform because there are so many researchers, innovators out here who want data. Again, I mean, all of you all would want data, correct? So what if the government allows you to access data at a much larger platform of millions and say, come up with your algorithms, which will help you all develop something more better? That would be better than you going into individual areas, going through struggling with ethics committees, hospitals. And that I think would be the solution for future bigger algorithms where government has to step in. So Karnataka government again has taken a lead to say that they'll create something like that, which is a data lake, which will be accessible to people under certain conditions. But that would actually accelerate the ecosystem of innovation much faster than any other place in the world. So whether it's images, whether it's heart ECG data, whether it is overall parameters, you could maybe get 10 million and you could be sitting on it and working on it. There are protocols that they're working on. Hopefully in the next couple of months, they should be able to come out with something like that. Thank you.
Thank you. So Shiva, your views?
So yeah, I think data. So if you talk about the data that is there, right? Human body is so complex, and when we talk about the AI models that our data is trained with, there are very few samples. So it's important that when we have the access to this large data, we need to ensure that it is continuously evolving as well, because we see the disease variants, right? This is mutate. So how can we design AI algorithms, right, in order to not only predict the disease, but can we also estimate, can we prevent the disease, right? So that is, I think, the world is slowly moving. Previously, it used to be like, once you predict, what is the treatment I can do? Now it is more like, how can you even prevent the disease, right? So there are a lot of AI startups that are coming in terms of how we can estimate a risk of person getting cancer or risk of person getting some disease. I think that's where the world is slowly moving on.
That moves me to the next question of, like, with a huge amount of data that's been correlated, and also I come from a research background, and one thing that I was like not able to answer to is the root cause of many problems. Let's say many cancers do not have a root cause, and also with 26 years old having a heart attack, and so many other things where we do not know a root cause to. So how do you think big data analysis and such technologies are transforming the spaces and the domains that you are in?
So if you see the big data analysis, right, with the data, we can predict what is the relation, but the data can also has its own challenges, because if you see the bias in data, the root cause or the correlation, what we might predict with the last data that we have can also be erroneous. So if you see, there are many instances where we see people claiming that they can predict so-and-so disease from, from some image, right? But then they are not into the real clinical deployment, because later down the road they might understand it could be due to some inherent bias in the data. So yes, data. If you have the large data, there is a good chance that you can find what could be the relation or what the root cause of it. But at the same time, you should not avoid what could be the biases in the data that you have.
I think with regarding to the data systems that we are talking about today, and all of us evolving in our own data sets, I feel there's a great potential for us to segregate and understand individual questions. And I equally give importance to small data. Let's not run to big data everywhere because our question forming is not happening. And I feel the question forming happenings when I work with AI analysts and others, I keep telling we work on small data which builds us a hypothesis, then we go to big data. This problem with big data is it creates a lot of noise which is not pertinent, and then it's like a wild goose chase. You're going on to something which is never relevant. So I think it's very important to have a hypothesis that is strong enough and then chase it and then put your efforts, money and time behind something that is tangible. Otherwise you're going to be having a complete wild goose chase, and that's what's happening with many AI companies that are shutting down. They've started with the wrong question, they've not measured the entire thing, and it's the algorithm that gave them an answer, and that's when they started chasing those parameters. And we are seeing that in oncology, we're seeing that in general health also. I think hopefully the future will again, I'm coming back to the single denominator, data reliability, and like he said, that the benchmarks are changing. So we are in a constantly evolving data system where we'll have to work together with I think multiple groups, biologists, scientists, working together in multiple clusters, creating relevant questions.
Is it standard? Is in the standardized format in India? Data, what we are talking, is it in a standardized?
So Ayushman Bharat, the digital mission, one of the biggest work that it was trying to do was related to data systems, to creating homogenized data.
Right.
Now, if you look at one of the discussions we had was, let's take up the TB elimination program. I mean, if any one of you all are aware, the National TB Elimination Program has been announced, and India has announced that we will eliminate TB by 2025. We've got 2 years left, correct? Now the entire country is sitting and trying to figure out, but 50% of the TB is still not diagnosed. So now comes the question on how can we bring in the world's country's best talent, the world's best expertise to look at. You've got 2 years left to eliminate TB from this country. Now that's not going to be an easy task, and that is where we will require proper data points, understanding homogenized data, and we've taken up this matter to tell unless you get a homogenized data standard system, and which is what Digital Mission is trying to achieve, then we can talk about the next step. That means to use that data and then after that use the sharing of it and then build algorithms based on it. Otherwise we're going to go grossly wrong.
So with respect to the data that we have talked about, like having a data that is reliable is very important, and processing it and the outcome that comes out of it and then chasing to a big data, as doctor said, is also important for evolution of a very good data model that could have a higher accuracy is also important. So moving on, I'd like to ask you about the privacy. The previous session also had mentioned about the privacy, and doctor, you had been on government panels as well, and as companies working with health data, what do you think the decentralization of health data is in India? How is it now? And also, how do you think it could move in the future?
So I think the previous session has very neatly covered different aspects of the privacy. And as startup companies working with the healthcare data, it's utmost important that we try to restrict or minimize the data which is personally identifiable. So because most of the AI algorithms, if you see, they don't really require the personal data, right? So it's important to decentralize the data or de-identify the data and create restrictions at different levels so that only few people in the company might be knowing what is the personally identifiable information, and most of the AI analysis or that might happen might not require this actual personal information. And as a startups, I think it's important that we adhere to the regulation that exists, like whether we are HIPAA compliant, whether we are following GDPR regulations. I think that is important. And data security is another aspect, I think, which we should look at. Because if our systems or our servers are not secured enough, then there might be a chance of data leak that might happen. And so there are ways we can protect them, right? Even while storing in the servers itself, you can de-identify and de-anonymize the data. So I think having stringent regulations from the data collection itself would be very helpful. And the second aspect is also in India also we are seeing a lot of times when data is being collected, it's important that we should take consent from the patient and see how we are, the patient should know what the data is going through, right? Is it being used for the training, or is it being for improving, or is it being sold to some other companies, right? It's also important that as a patient or as a person who is taking a test, they should know. And at the same time, even if you see NHS and other healthcare systems, it's important that the patient should know whether AI has been used in their report generation, because if you don't explicitly mention, then it might happen that the report is directly generated by AI and might be overlooked by radiologists. Or is it reviewed by radiologist and AI as well, or is it simply AI report? I think that kind of data transparency also have to be in place, and we are slowly seeing all these in the Indian startup ecosystem as well.
When we So when we started, last year, the most common question, objection, or situation we faced is data privacy. Every doctor, every patient, every hospital was only asking about this. First, you come or clarify this aspect, then the next move. And they're all talking not because I am trying to give this service, but they're all talking from their own experiences. They all had certain bad experiences from their previous digital or technology solutions. Someone has done something, someone has taken the data and disappeared, someone has misused the data, someone has transferred the data from one hospital to another hospital. All such experiences have gone through. So from day one, we said at UP Digital that at least this would be taken with utmost care. And I'm sure all of us would have got since morning spam phone calls, spam messages. But look at the life of a patient, a cardiac patient, suppose, if I talk about what kind of data is holding. It is one prescription paper, what you see in the hand of a patient. It carries 7 or 8 brand names of different companies. It carries diagnosis of the patient. It carries various vital information. It also carries doctor's information. One piece of paper carries multiple sets of data in that. And when when a doctor or a hospital or a patient is asking for data privacy, it's a very valid demand from their side, we feel. So we take consent from the patient. We also give a consent to the hospital or the doctor upon where we draw a line. If we are into cardiac rehab, what exactly we are intended to deliver, and whatever data is required to monitor the patient's progression is what we use. Rest of the data is definitely masked. We from day one we have taken this as the pivotal thing, and probably I think all startups, if you are able to make those early steps properly, probably this data privacy from a question would become a very productive thing. Okay, what can be done with this kind of data? What we have today. Yeah.
But the problem with that is when we as a startup, we are working with brain sensing technologies and we even dealing with brain data. The problem as a startup that I envision is there's no standardization with which I can follow and go ahead and do that, but it is completely customized and different for different sectors. So is there a way that government is doing something to handling that as well?
Data privacy is a double-edged sword. I think on one side, all of us here sitting on this panel, their data is being loosely used by somebody somewhere else, whether it is WhatsApp or Facebook or somewhere. So you have on the one end, while you're assuming that you're completely having data privacy, absolutely no, there's no data privacy. That's the ground reality of it. That somewhere out there, our data are loosely being floated around. At the same time, when you look at health interventions and you're looking at certain aspects of legalized approaches to research and science and innovations, suddenly this data privacy comes up into an extreme mode to say that no, data privacy is the most crucial. And I have seen two flip sides to it inside this. That is, one aspect is, I think the owner of the data is the most important. Finally, whole story revolves around who owns this data. It's the patient. So it's the owner of the data who needs to give the permissions either for research or for innovation or for a new product. Now, I sit on ethics committees and chair some of them. So as a broad thing from the government's perspective, the ethical guidelines, and there are regulatory guidelines, but they come after the ethical guidelines. The ethical guidelines say that as long as the person who owns the data is agreeing to share the data, you can use that for advancement of science, and that's a good purpose. And this kind of an approach should not be dealt with in a monetary way, because somewhere down the line, I'm trying to talk about a startup. Let's assume that you have a startup. I'm trying to encourage somebody to build a good science somewhere, and this should be done with the right spirit of what we call the temperament of advancement of science. Unless we do this, we are not going to be able to change this ecosystem of innovation. We're going to get too tight, too controlled. We're not going to be able to make that progress. So somewhere down the line, everybody is thinking that yes, we need to understand and not scare people about this data related thing, because somewhere it's going to be used, and that's the only way to allow people to do more research and encourage more people. Otherwise, at every step, you'll have ethics committee, scientific committee, hospital committee, then you'll have the regulatory committee sitting on you, and you'll not be able to move further. Innovation, research, science won't progress. So somewhere I think data privacy, yes, has to be looked into, and we are working towards understanding how we facilitate it. At the same time, there are a lot of interest from patients. Like for example, you've gathered 20 patients' data, of which 10 people, later on 5 years from now, you discover that you had one algorithm that you just got, which could have corrected them before. What is the implication of this on that patients? Should you be able to tell them that, look, we could have done that earlier, but we couldn't have done it? A lot of people ask us this question when you do genetics and other things. In the future, if something happens, will you be informing us about this? And these are questions we still don't have answers to, and regulatory still doesn't want to touch such tough questions at this point in time. Thank you.
So my question to you, Doctor, again is with respect to radiology generally, and also you had mentioned, Shiva, on how radiology is integrating AI and how it has been useful right now. There has been cases where AI has been more accurate as opposed to a doctor as well, with the recent studies that has come out. So there is this curious question that I have is, how is the future of AI in 100 to 150 years, future of radiology or healthcare in general is going to be transformed in 100 to 150 years? And do you think the typical question that's been asked by clinicians altogether when we take AI or such technologies to them is that, will I be replaced? So what do you think?
I'll close with two quick comments on this. I think if you look at, like I said, industry is at 4.2, web is at 3.2, health is at 2.2. Health is going to jump up, and as we are going to get more and more of these new technologies, we have to pace up with them. And I unfortunately say that if you look at today the way robotics has come in, if you look at the way all of these new technologies are coming, we will have to embrace them. Somebody asked me this question in one of the panels in Stanford, and I told them, I said, will the doctor be replaced by AI and robots? I said, yes, he will be. And it is the time for clinical scientists. That means I'm spending a lot of my time in labs. So the next generation is for future medicine. So you'll have pathology and radiology work together. That means a radiologist who is a simple radiologist is doing today interventional radiology. That means he's behaving like a surgeon. You ask me about an interventional cardiologist, he's a physician, he's going inside the OT. Whereas if you ask me about a navigation surgeon, he's a surgeon who's doing radiology. So this is already started. You cannot stop this from moving further now. Fusion branches are going to come much faster. Pathology will be sitting inside the radiology department in next 10 years. And in this whole bargain, will the doctor get replaced? Yes, he will. And I'm just telling on a lighter note, Stanford, many people got upset in that panel, and I was the only happy fellow. I said, don't worry. I said, I will not do MCH in oncology, I'll do MTech in oncology, but I'll still be there. You don't worry about this whole discussion. Right now, keep going on. But do learn AI, understand the entire framework of all these systems, because technology has to be moved hand to hand. And there is never a better time in history for us to accelerate human healing than this time. So I think let's embrace technology, not get scared of it at this point. Thank you.
I think that was a better closing note for the whole session of AI and the evolution of the 4Ps in the patient outcome. So, with respect to that, we have had our like the esteemed panel talk about the precision with respect to the data that we collect, the accuracy, and also with respect to how all the 4Ps can be addressed. And also, as Doctor mentioned as well, we will also have or be born with the Kundli with health data as well. And that's the way it's going to be transformed. And thank you so much for being a great audience and also the great panel as well. Thank you.
Thank you so much for your lovely insights. I'll request all of you to wait there for the group photo. And I'll call upon stage Mr. Harbinder Narula, CEO, BW Healthcare World and Wellbeing World, to kindly give away the mementos for this session. Let's give it up for this lovely panel, ladies and gentlemen. Come on. Thank you so much. Really fascinating discussions on AI. Just wondering, maybe an event after 20, 30 years, will there be a physical host or AI? Thank you so much. With that, we come to the final session before lunch. I know we all are hungry, it's late as well, so please enjoy the delicacies outside. We have some lovely nuts waiting for you all. We'll resume after 10 minutes. Thank you so much. right, ladies and gentlemen, good to see you all back after lunch. We're all set to begin the second half of this lovely day. I'll request you all to take your seats so that we can begin the proceedings. Request you all to kindly take your seats so that we can begin the proceedings. I hope you all had a lovely lunch. So I guess we're all sorted. So welcome to the second half of Festival of Health Tech 2023. We are all set to begin the first panel discussion post-lunch. The subject is patient safety, role of younger healthcare professionals. Taking this year's theme for patient safety forward, the role of younger healthcare professionals in spreading the awareness around patient safety and its key attributes will be discussed. To moderate this session, may I please call upon stage Dr. Astha Saxena, consultant psycho-oncologist, Metro Cancer Institute, Faridabad. Loud cheers, ladies and gentlemen. The first session after lunch. Let's show some energy, please. She'll be joined by Dr. Kamini Rao, founder, chairperson, Medline Academics, and chief mentor, Milan Hospital and Birthing Center. Loud cheers, please, for Dr. Kamini Rao. Welcome, ma'am. And we also have Dr. Swati Bhatt, MD, Intervention Pain and Spine Center, Sahakar Nagar, if that's the right pronunciation. We have the LED and everything sorted. So just a quick heads up, Dr. B. Bhaskar Rao won't be able to join due to an emergency, so we can go ahead with the session. Are you all sorted and ready? Thank you. It's all yours.
A very good afternoon to all, and thank you for being here. I'm Dr. Asta Saxena, and I will be moderating this panel today. So the topic is patient safety and the role of young healthcare professionals. When it comes to patient safety, I think we consider mental health, physical health, and emotional well-being of the patients. Sorry. I'll be asking some questions from the panelists. And ma'am, for you, the question is, how can the medical institutions instill the idea of creating awareness about patient safety at an early stage in medical education?
I think what we have today is a curriculum which is devoid of bringing in the kind of empathy that we have towards patients. Because in the olden days, a time when I did medicine, and this is almost 2 generations ago, we looked at it as a patient-centric approach. And today it has become more technology-centric and an organ-specific approach. And we looked at a patient either as a gallbladder or as a uterus or as an eye. And when we even refer to the patient, we look at bed number something, or that polycystic patient, or we look at that patient who has had a hemorrhage. So we've even forgotten that that person has a name to such an extent that they become almost inanimate objects and they are commodified. And in come corporates, and we find that they almost have a band, like how I've been put a band as I walked in. So, and when I looked at the band, there was no name on it other than Businessworld. So, if such is the situation, then we now want to know as how do we give an identity to the patient. So, this person-centric approach that we need to inculcate in our young students who actually come out right from the day they enter the portals of a medical institution is to tell them that you're treating a person and not a commodity or not an illness. So once you take mind and matter, or you take mind and body, I think all the things will get into order. So you have to go systematically. History taking has to be very clear. It cannot be replaced by machines. If that can be understood right in the beginning, calling the person by name, standing up to welcome the patient inside, and making her comfortable or him comfortable, and then listening to the person, putting your cell phones off, having an eye-to-eye contact, keeping an atmosphere which is conducive for the person to talk about their personal issues, and not having too much of noise around, and not too much of the phones ringing up, the intercoms. I think that would be the respect you would give, particularly when you charge the patient.
Ma'am, see, I'm a psychologist, and the points that you have mentioned, I totally agree with it. Because when we meet patient, the patient want our attention. They want themselves to be called by their name. ना कि ऐसे कि वो patient is called by the patient, as you mentioned. Bed number patient कौन सा है, 9 bed का patient कौन सा है, no. They want like, if the patient's name is Aman, let it be Aman. They're like, yeah, patient Aman. Hi Aman, how are you? How are you doing? So they feel connected to the doctors as well. Ma'am, the next question for you, ma'am, Swati ma'am. As a veteran in this field, how do you think has the concept of patient safety evolved over the years?
Thank you, Asta. That's a good question. Thanks for having me around in the first place. I think over the years, we have evolved a lot in terms of patient safety. So over the years, I think at the era right now that we are into has moved from a goal to a concept. And the concept is that it is not a goal which has to be achieved today, tomorrow. We are not setting guidelines for us or some numbers for us that we have to touch. It's a whole process. We all need to understand that it is not something which is gauged or monitored by just hitting down the numbers. What you have is discharge criteria is met or not met. Just coming to those numbers per se. It's all about a continuum, right? And in that continuum, a common example which we can understand is that the entire machinery of this patient safety and the health system is just like a cycle, wherein the young individuals, the young healthcare professionals, the doctors are those two wheels which will most often take the ride forward. But we most often don't realize that it's the other things like the steering, which is your nursing. There is the chain, which is your paramedic staff. And so many people like the ambulance driver. Everybody in this system is a part of this system. So it's a process. That's why I said it's a process. So every individual here needs to understand that they have a role, which is, so it's not like, patient safety is only my issue, or it's only a nurse's issue, or it's only a doctor's issue. No, the entire thing needs to be looked into a one full picture as such. So I think we've evolved a lot. And what is most important over here is to recognize that we have to create a system wherein we make it so friendly for the staff. Only if I admit that there is a mistake, there is a chance that I can improve. But most often what happens is a nurse creates some mistake. She will not bring it up on the table. She will not own it up. Because of the fear that everybody is going to criticize her, she might lose the job. So from a punishment, if we move to a reward concept, and if we all look at the patient safety as a goal for everybody to be achieved, I think that is what is dynamic, and that is something that we should be working towards. So I think emotional comfort of everybody in the system needs to be very, very strong. That the nurse has to be emotionally respected, her work has to be respected as much as the individuals like the younger doctors who spend most of the time on the floors with the patients.
the other paramedics, everybody. So everybody needs to understand and be recognized for the work that they're great work that they are doing. Versus the people who are at the top level, they of course have to see so many patients. They might not get so much of time, but it is the younger generation doctors who will be spending most of the time with these patients. And I think that is the entire concept that we have to work upon, and I think we have come down to that as well.
Yes, ma'am. So, like I have seen junior residents in my hospital as well. So, as you mentioned, they spend more time with the patients than the senior doctors. So, yeah, we need some initiatives that we can train them more, I guess, in the field that they can provide health safety for the patient. Not in the concept of only health, mental stability, emotional support also. Ma'am, this will be an open question for all. How is tech helping safety? Are surgeries safe today? Do people recover faster?
I think this is a very open-ended question, and I think first and foremost, I would like to take it in two parts. Is surgery really required? Sometimes I find surgery is overemphasized and is done even if it's not indicated. So let me put it across when what it really requires is a little bit more time, more counseling. Given the choices we have, counseling plays a very important role in trying to, explain to the patient what is required for her to actually manage the problem. And I find that in my specialty, for example, I find women who are in the age groups of even 28, 29, even though they've had two children, and just because they come with one episode of heavy bleeding, they are suggested to have a hysterectomy. And I think this is something which is horrendous when you have a lot of other treatments available, and to go ahead and just castrate this person and just get the uterus out, I think is absolutely wrong. And therefore, the first question would be, is it really required? So if we can answer that ethical question, if it was your own mother, your sister, or your daughter, would you have done that? And if that answer was yes, then okay, I would buy that thing. The second thing is, are surgeries safe? The answer is yes. With technology, I think a lot of things have improved. The monitoring systems that are there, the pre-anesthetic evaluations, and also the kind of blood gases, as well as how under anesthesia the patient is monitored, is certainly far better than what was being done earlier. But the core question I want to put across is, are we not doing unnecessary surgeries? I think if we can work around that problem and also have the corporate teams not breathe down on the doctor's neck and say, how much have we brought this particular month, and have the clock ticking and say that your next increment will depend on how much moolah comes into the kitty on your name. So I think it's a kind of a vicious cycle. Now, they have to answer their investors who have invested in the company, and the doctors have to answer to the corporate honchos that if they don't bring in that kind of money, then they don't get an increment. And then on the top, everyone is quite nice and say we have to actually give the right things to the patient. So there's a sense of a bonhomie which is very superficial. Thankfully, I was not in a corporate sector for a long time, but I had the best of both worlds, being in the corporate sector and being by myself. But I can tell you very clearly, there's a very stark difference. When you're in a corporate sector, you always have to look at that taximeter running on your head. At the end of the month, they'll be looking at it and saying that we've not done this, we've not done, EBITDA is not there. I had never heard about EBITDA when I was running the clinic myself, and I really did extremely well, and I still didn't know, because the pluses and minuses and numbers was not my forte. But only when I got into the corporate sector, I realized that I was being monitored. And I found it extremely difficult to say that the number of tests that came in was far less. The number of drugs that were being prescribed was far less. Because I think the doctors have now been pushed into a corner that they cannot function properly, and if they have to function properly, they have to do this. So they are in a kind of a Christian pool at this point of time. So if I want to tell them, look, you have to practice ethically, you have to have the Hippocrates oath, they have a Damocles sword on their head with the corporates on that side. So please tell me, how do I advise my young students come through my centers, because tens of thousands I have trained, and when they're training with me, there's absolutely no bullet on their head to practice unethically. And they all come and tell me, this is what we have. They get very fat salaries, they get poached from every clinic, and the moment they are poached and they're put into their centers, they're promised big salaries, but then the taxi meter starts. So, to all the corporate sectors, I understand your own problems as well, but we have to find a solution to that. Thank you.
Would you like to share your insight?
Would you repeat the question for me?
Yes, ma'am. How is tech helping safety? Are surgeries safe for today? Are they safe today?
I think I have a very clear-cut thought on that. We have moved in technology. We have done leaps and bounds. I think after the last session that we had on AI, I don't need to verbalize it more. We have definitely, technology has added to, of course, a lot of astounding benefits over the open-end surgeries that we used to do. So definitely, I would say yes, recovery. What was the last part of the question? Definitely, it's very, very fast when you are doing a laparoscopic or a robotic surgery as compared to an open surgery, which would require a patient at least 4 to 8 weeks to recuperate from that. In that way, definitely we have made a lot of advancement, and it's quite safe in very well skilled and experienced hands. One. The second, technology having helped us in many ways, we don't require very hi-fi technology. But to make use of the technology adequately, I think sticking to the norms is the most important thing, right? So if you have a system wherein you can track back your data, what tells you why a patient at all went to the ward after surgery and went to the ICU, you have to track the data every day, right? It's the same way if you track the data from the emergency, the patient went to either the ward or went to the theater, and then how much was the time? Did the patient get out of the ICU and come back to the ICU, which means why was there a need to go back to the ICU? So all these technology-driven data is what we have added a lot, have helped us a lot to bring down this incidence. Now, the only idea is, or the only best practice is, you get these data and stick to those data and see them every day, read them every day. We don't need very hi-fi technology. You may not really require a retinal, whatever you have, all these technologies nowadays to predict. There are other predictors as well. But as long as we stick to those predictors every day in our day-to-day lives, I think we can do a miraculous job, and we are already doing. India as a country, you may not be able to afford very hi-fi technology, but do we need it actually? Whatever we have, if we make the best use of that, that would be a step ahead.
Thank you so much, ma'am. Ma'am, so I'm a psycho-oncologist and I'm just 27 years old. So is there any advice that you want to give me? Like, this is the starting of my career. So is there any advice? Since we are talking on patient safety only. So
I think the very important thing is we need a psychologist in every consultation, and I think every patient needs the support of people like you, because many times they are very confused when a doctor talks to them in a lingo that they don't understand, and I think a friendly psychologist is an integral part of the community. Very, very important.
Thank you so much, ma'am. Thank you so much. Thank you so much, audience.
Thank you so much for those insights. Request you all to please wait so that the mementos and the photographs can be done. I'd like to call upon stage Mr. Harvindan Narula, CEO, BW healthcare world and BW well-being world to present the mementos. And can we have the group photograph with Harvinder sir, please? Just wait for 1 minute. Do we have the mementos here? Let's give it up for this lovely panel, ladies and gentlemen. Thank you so much. Time for the group photo. Thank you so much, all of you. We'll just take 2 minutes for the next discussion. In the meantime, till the setup is done, you can play a promo. I believe you're all ready, so hold on to the program, you're all set. So the next panel discussion right now is about something very interesting. Everybody talks about startups, startup is this, startup is that. While there are so many perks involved with it, there's also a set of challenges that's there. And it's important to explore and understand how those challenges can be conquered in the best way, right? So the topic right now is the opportunities as well as the challenges that startups have. This panel discussion brings forward the opportunities available for startups in Indian ecosystem, the challenges that they are facing at present, stories around how these challenges can be curbed, and government initiatives under Make in India scheme. To moderate this session, may I please welcome Sabhyata Verma, Assistant Vice President, Invest India, on stage, please. Cheers, please. She'll be joined on stage by Sunil Khurana, MD BPL Medical Technologies. Hi, sir. Rishabh Telang, fitness expert and dream chaser Cure Fit. The fitness part is very visible in his personality. Vinil Matthew, manager, Startup India. Hi, sir. So the stage is set, the panel is ready, let's get going. Thank you.
Thank you. A very good afternoon, ladies and gentlemen. My name is Sabhyata. I'm from Invest India. I'll be moderating today's session. I think we've already had a brief intro about who the panelists would be. I'll quickly introduce again. We're joined by Mr. Sunil Khurana, MD BPL Medical Technologies, Mr. Rishabh Telang, fitness expert and dream chaser Cure.fit, and Mr. Vinil Matthew, manager, Startup India. We'll be talking about this very interesting topic on the opportunities and challenges for startups. And as we all know that startups thrive in a very, very unstructured environment. That brings me to my first question to Rishabh, which essentially is, what has your role been and experience in standardizing an otherwise very unstructured workforce in the healthcare industry?
Thank you very much for having me here, first of all. So I think the unstructured industry that you're talking about is fitness trainers. We, at Cult and all our partner gyms, we employ about 3,000 plus instructors, and which was otherwise a very unstructured working environment. So when Cult came in, we did a bunch of things. First, we just tried to create a code of respect and empathy around the working environment and in every interaction that we do with trainers, because that is something that was missing. I am a trainer myself, started Cult in 2015, and the first thing that I wanted to do at that time was make sure that people who live for passion, they start getting the kind of respect that they deserve. And because I come from a sporting and a training background, empathy is something that also took a core presence in our philosophy. Second, the biggest lever that I think played a part in terms of standardizing the the unstructured bit in this industry was a highly efficient org, because I think it's all about people. I am a fan of technology. Of course, there is an app, and we do logging and all of those things. I log my own workouts and nutrition, but I feel that it is all about people. And I was, hearing the last panel talk about empathy in medical scheme of things, and in fact, I took a video of that because I was really impressed with the kind of things that were spoken about, and especially in the fitness ecosystem. That is something that was missing. So, a highly efficient org, powered by capabilities that can help manage trainers every single day with a lot of granularity. So we built all those systems over a period of time, and that helped us just standardize how we deliver workouts, which is otherwise very complicated because it's essentially a set of skills that people have forgotten over a period of time, and teach them across million instances every single day in a very standardized way. And that happened because of the capabilities and the people that I spoke about.
Interesting. I think that brings me to my next question to you, Binil. Given we just spoke about some of these challenges, what do you think is the role of Startup India here in navigating some of the challenges that startups in general face?
One of the key things, and I think what would help is if I give like a small brief of the Startup India initiative. The Startup India initiative was set up by the government of India back in 2016 to help the startup ecosystem in the country grow. Because at that point of time, while there were a bunch of startups who were working, creating good employment, and also going ahead and contributing to the economy of the country, there was some structure that was necessary in terms of the support ecosystem that would be provided to them. And the challenges that are being talked about in terms of how employee welfare works, how empathy works, also requires an ecosystem to go ahead and enable it, where all the stakeholders involved in it also create it as a center of how they're looking at how the business is being created. With that in mind, the Startup India initiative, when it started, there were roughly around 4,000 startups in the country. Now that we're 7 years down the line, we have more than 99,000 startups who are registered within the country and who are being functioning within specific domains. One of the first things that helped in identifying what the ecosystem required and the kind of support on structuring the ecosystem required was in terms of listening to the ecosystem through a specific program called the Startup India Yatra, which went to different districts of the country, talked to entrepreneurs, went ahead and told different partners within countries about what entrepreneurship can be. Now, what ends up happening is when things start scaling, there's also different kind of support mechanisms that need to come into play. I was very happy to see Nirmay on the panel, like in the morning sessions, because Nirmay was one of the first awardees of the National Startup Awards, which was started back in 2020 to go ahead and recognize startups who are doing great work in the healthcare sector and multiple other sectors. So the government has been making schemes to go ahead and give support to the ecosystem at different stages. Initially, when it was in terms of awareness, there was a learning program that was launched, which is still functioning. Then when it was in terms of recognition, then there was the National Startup Awards program that was launched. Currently, there's a seed fund scheme that is operational to bridge the gap between the valley of death, where most startups come to ideation but aren't able to build their prototype, go to an MVP stage, where the government has now announced a fund which goes ahead and provides up to 20 lakhs in grant money and 50 lakhs in debentures to support these startups. Building on that, last year we also launched the credit guarantee scheme, which allows you to take credit guarantee from certain banks in the ecosystem. And now we are also working towards mentorship specifically through the MARC portal. So the way that the government has been working around this is building it block by block. Because if you push out all the solutions in the ecosystem together, they will not be able to complement each other. And it also helps us learn how is it that the solutions can work with each other, how is it that they can help the startups to build economy in the country and job creation. The 99,000 that startups that I told you about, they're now spread across every state in the country. They employ over 10 lakh people cumulatively, and they have gone ahead and helped us become the third largest startup ecosystem in the world with the number of unicorns we have. So it's a step-by-step process that we are also working with the ecosystem on developing.
Great. I think with Startup India paving way for Make in India and giving a boost to our homegrown entrepreneurs, Sunil, my next question to you is how do you think can the perception of Make in India be further developed in the healthcare industry in general and sort of reduce the dependency on foreign players?
Thank you, Sabita, and thanks for having me here. Sorry, my bad throat, so probably communication. First, let's understand what is the problem statement. Problem statement started a couple of years back when we all witnessed COVID pandemic. And that time we realized, as India in local, we are not ready with the sufficient medical devices. Patients were coming, getting admitted, and we were not having enough medical devices to support them. And that is a time when there was a lots and lots of young cry that we need to be self-reliant. We have to go into the Atmanirbhar side, and that is where this concept of this drive started, that let's make more and more medical devices within India. Today, burden is about 80-85% medical devices come from outside, only about 15% are made here. There are many challenges. We can actually have a lot of discussions there that how it has to happen. But medical devices itself is a very complex to understand. A glove or a suture or a syringe is also a medical devices. Other side, MRI, cyclotron or PET CT is also medical devices. You cannot have one regulation to manage the entire medical devices, entire end-to-end medical devices, whereas currently medical devices is being managed by Cosmetic and Drug Act. So there are long ways to go. Total globally medical device size is about 600 billion. In India, we are sitting at about 12 billion. It's too small from government point of view to bring a lot of focus. But I'm happy. In the last 4 decades, I have not really seen this kind of drive, which is now happening in the last couple of years, that we want to make more and more here. I'm very, very excited to see the entrepreneurs, all these startups, the way those young boys are coming and actually taking up something very unique. They are going for a problem statement. They understand what is the actually issue they have faced or their families have faced, and they want to get into that. Many jump into without understanding the whole, end-to-end understanding that what needs to be done and how the funding will come and how will they take the product to the market. That's a different aspect altogether. But there's a lot good happening there. My view is that next 15 years, this industry in India will cross $50 billion. That's my personal understanding. We have grown at BPL Medical 10 times in last 10 years' time. 10 times. And I'm pretty sure that we will be a $1 billion company in time to come. So there is a huge scope. Paying propensity is increasing. People are now going for a proactive, treatment than reactive approach, which used to happen quite a lot earlier because you have a surplus money and awareness is there. So Make in India is bound to do well, and you will have a less burden on the foreign importation. Though we need to do many things at the government level. I'm just looking at the time as well. So I'll stop here and maybe the next round I'll touch something more. Thank you.
Great. I think in this context, Vinil, my next question to you is, since we're already talking about schemes, government schemes here, how is the Startup India scheme specifically helping the startup ecosystem in the country?
Okay, I think I touched upon a few of the active schemes that we have, but what I'm going to do is give you a picture of how these schemes work in conjunction, right? Like currently the healthcare startup ecosystem in the country, we have over 9,000 startups who are currently functioning as part of the ecosystem in the country, which means roughly around 10% of all startups in the country work in the healthcare and lifestyle sector. Now, when we look at this, there is a gestation period that a startup is going through, and there are certain challenges through those gestation period that the startup is answering. A key question that they have to answer is, what is a product, how is a product helping the market, and is there a need for the market? A lot of challenges do come up on the initial stages of finding product market fit, especially in a sector like healthcare where trust is a key factor. Nobody wants to try out the healthcare product where there is a lack of trust. So how is it that you go ahead and build these trust, right? There are 3 ways that we as a scheme basically go ahead and help entrepreneurs with it. Because one of the key issues that was highlighted to us by entrepreneurs was in terms of that when healthcare startups are working with different institutions, there's a gestation period for even R&D development. In that R&D development, how is it that support can be specifically extended? A key part of this is the early period when product development is happening, where startups are given, of course, seed grant. But what they're also provided with is an opportunity to work very closely with incubators who work in the ecosystem. Because a key pillar of how startups develop is the incubator ecosystem. And for this specifically, Startup India has been working for the seed fund scheme specifically through the incubators. So the startups reach out to the incubators, apply through them. Secondly, a second problem statement that comes up is, okay, we have that seed money. How is it that we go ahead and build this as a business? Because that is an area where a lot of people do lack expertise. It's not necessary that everybody who's building a startup also knows how to build a business. Now, this is specifically where the MARC platform that the Startup India scheme has launched goes ahead and connects you from mentors from across the country who help you break down the idea of your startup, the business model, and the kind of support that you require. Now, why this is necessary is that the next stage, you've built your idea, you've tried out a small pilot, you've gotten some mentorship. The next stage is in terms of how is it that you create a scalable business, or you go ahead and also get funded from larger pool of investors, right? You need mentors who will guide you through that. You will also need schemes which help you along with this. And this is where we work very specifically with state governments in going ahead and encouraging state governments to have their own startup policies. The state startup ranking framework, which the Startup India team releases every year, goes ahead and looks at how is it that every state is specifically performing in the startup ecosystem. So in like summation, what I would say is that there are three main factors that we are working at. We are working at upskilling the entrepreneurs themselves. Second, we are looking at how is it that the ecosystem in itself can develop, whether it be funders, because specifically for funders, we have an Investor Connect portal, whether it be for incubators, or even looking at our international partners. And third is in terms of going ahead and working with our state partners. And the schemes over a period of time, and there are multiple schemes that currently the government is working on. One of the key questions that comes to us is in terms of, is there any healthcare focused scheme? There isn't a healthcare focused scheme because the reason for that is that a lot of the problems that are faced by startups at the early stage or even when they're building are common across a certain paradigm in business. The specific support that they will require for R&D, the specific support they'll require for product market fit is then provided by the MARC platform, the Investor Connect platform, and other such initiatives by the government.
Thank you, Binil. Since we're already talking about schemes and some of the job opportunities that actually come in with that, Rishabh, my question to you essentially is, would you like to reflect on your journey as an early stage entrepreneur in the healthcare industry and detail some of the best practices as a homegrown Indian startup?
Yeah, I think so when I started, it was fairly, I mean, fitness has not been a new concept. It's been there since forever. But when I started with a very differentiated concept. So the background is that I used to be an athlete, a basketball player. I wanted to make my career in that sport, which did not happen. So I had to study and then I knew I'll have to get a job. I worked in corporate for about 6.5 years and then traveled a lot, different parts of the world. Realized that my true calling is fitness and sports. So I got back to sports through Brazilian Jiu-Jitsu and competed again. While I was doing all of that, I realized that I'm spending a lot of time doing fitness and sports, not really doing justice to my job. And I really loved fitness as a concept and was thrilled by the idea of making other people fit. And that's where all of it started getting deeper into fitness as a science, research and methodologies and all the certifications that are happening. And through that, I built a lot of connects and inspiration across different parts of the country. And those are the people who also helped me start the first cult center in 2015. And then over a period of time, a few things, and of course, being very fortunate, met the right people, was there at the right time, worked very hard, was able to hire the right kind of talent. And fortunately in India, there is a lot of talent which is untapped. And we realized only when I started traveling to all the remote parts of the country. So suddenly from traveling to Europe and US and learning different forms of fitness, I started traveling to villages in Haryana, to Guwahati, deep south and all of those things just to meet the sporting talent in the country. And that is where I realized there is so much love for fitness. There is so much passion for making people fit that we can actually create an ecosystem out of this whole thing. But then they were all athletes. And being a good athlete does not necessarily mean that you can be a great coach or you can teach people fitness, and which is where capabilities like a training academy came into picture. So we built a standalone training academy for training all of those trainers who get onboarded on Cult. While there are these certifications that do exist, so if you look at American Council on Exercise, National Academy of Sports Medicine, and I do work with a bunch of them. I am certified with all of them. I do work with a bunch of them even right now. But then the courses that we created for our trainers were built for them, were built for, first of all, trainers in India. They were also built for trainers to deliver a great quality class in Cult. The downside is that all the research that mostly happens in the space of fitness has happened in America and things like that. So we did a lot of first-hand research in our setup. We also made sure that we understand what our members are happy about, what they're unhappy about, what are things that can lead to injury. So, for example, any injury that happens inside a Cult center is recorded, is deeply analyzed, and we take decisions on what movements should we retain and what movements should we relegate. For example, we realized that when we do lateral jumps, people end up getting injured. So we started removing lateral jumps and scaling it down. And this is just one example. I have many examples of changes that we've made through the data. And we made sure that all of those things feed into the courses that we are doing for our trainers. So a trainer, when they go onto a workout floor, they know exactly what members will be happy about or unhappy about. They are also powered by all the movement coaching and science that we teach them at the time of training. So some of those capabilities and how we manage them on a day-to-day basis through the org that I spoke about, a very highly capable team of people that are very efficient people managers, a trainers app that helps them look at their performance every single day. Again, the continuation of training academy that trains them as soon as they fall into their performances on any particular parameter. So a very foolproof system that helped us scale to so many instructors delivering the kind of quality they deliver. So all of it, tying in from how I just had a lot of inspiration from trainers in different countries to how I understood and tied them across different sporting talent that I found in India.
Great. I think, Sunil, my next question to you is you brought in a very interesting point related to Atmanirbhar Bharat. So I think sort of dovetailing to that, given BPL is an approved applicant under the PLI scheme, which is the production linked incentive scheme, how is the PLI scheme helping in creating Atmanirbhar Bharat, and how do you think is it going to further create job opportunities?
Yeah, good question. Thank you. See, PLI is basically designed to promote the local production. So Make in India and PLI are almost the same. What PLI brought is that they brought a lot of excitement. They created certain incentives where we all jumped into that to set up a new greenfield plant, and from there we make a product and company. Government is going to buy assured quantity from there because there will be a preferential treatment. At the same time, we will get certain percentage back, which can further come back into the system of R&D. So PLI has been amazingly good. But let's understand, what do you need to start the manufacturing? Before that, you have to have a product. Now, to have a product, you have to have a R&D. So either you have an in-house R&D or you get a technology from outside. So there are two options. Either you get a TOT, which is transfer of technology from some company where products are already established, time-tested product, you get that, or you put your R&D people. So unless R&D is really scaled up, unless there is a very strong activity done at the R&D level, because companies may not have sufficient ROI, return on investment on the R&D, and they do a lot of shortcut. Now, what government has done a couple of weeks back, they have launched a new scheme by name PRIP, PRIP. This is promotion of research and innovation in pharma and medtech. So this was actually much needed, and we were talking always about promoting and getting some kind of subsidy toward the R&D. And also government, what they're trying to now do is that if you look at the global organizations, they all have a tie-up with the academia. So I talk here, we have been listening since morning and several lectures about AI. You all know AI. But what AI I want to say here is very different. It's academia and industry partnership. That is something very important. Because if you go to IIT or ISB in these institutes, they're very bright people. Professors don't have a pressure of ROI. They can take some problem statement and solve it. Let us take, I'm giving an example that I want to, let's take, build one product by name AGM gas module. I might probably consume only 100 or 200 units a year. And probably 10 crore is investment there. It will never look me viable and I'll keep buying it. But if institutes like IIT takes that as a project and gives to companies like us, technology is available, you start localizing it. So role of, academia is a very, very big. So that is one area where, we need to do a lot. Second, if you really want to make PLI successful, you also should see that then you get a preferential treatment or you get some entry barrier of a similar products which are coming from outside. The barrier becomes a little high, then only you can do it. Like you see auto industry. Auto has been given a lot of those privileges and you cannot get imported cars from outside that easily. If you still want to bring, you pay very high entry barrier, high custom. Today, when we take a components, we pay high duty on the components which we use to build a medical equipment here, whereas the finished medical device comes at 5 or 7% custom. So, there are still many things needs to be corrected, but I'm optimistic the way we are going, the way government is working. I must really give a huge compliment and thank to government body that almost every alternate week we get a call from, ministries to know that what hurdles we are facing, what support we need from them. Though we still keep talking about single window, which will solve everything. I'm still searching for that window. But overall, huge positive side from government to solve it. And I think PLI is going to go a long way. I have no doubt in my mind that today with the China plus one, everybody wants to have an alternative to China, global industry. India is really very rightly poised there and we can build a lot many products. Though R&D takes time to build a product, so we need to have both routes. Some we build inside and some we have a partnerships. I'm not trying to say against multinational. Let multinational also come and make product here, MNCs. But that will help us to further expand and have more and more jobs here. Thank you.
Wonderful. I'd like to thank everybody here on the panel with me today for all the lovely insights. We've typically covered the journey of a startup, the conducive environment which the government is enabling for the growth of startups and the healthcare industry in general to boost the innovation and investments. I hope the panel illuminated for you the opportunities available for India's growth story in the healthcare domain. We'd be happy to connect offline. Have a great rest of the day. Thank you.
Thank you so much. Lovely progressive thoughts. I'll request Dr. Velumani, creator, Thyrocare, to come up on stage to give away the memento for this session. And we can have the group photograph after that. Thank you so much. Please loud cheers, ladies and gentlemen, after every session. Thank you. I'm sure the insights are going to help a lot of startup founders going forward. Thank you so much. We'll see you very soon. Thank you. Now, ladies and gentlemen, whenever we hear this word business, I think we all tend to think, sometimes people say this human being is very business minded, this, that. So normally we tend to not relate business with emotions. But the subject that we have right now, it's exactly about that, how we connect empathy and emotions with business. The subject right now for the discussion is a nostalgia, empathy meets business. This Heart to Heart talk is all about the story of Goodfellows, a young startup working with love and empathy and extending compassion for the elders who seek a companion. A lovely initiative. Loud cheers for this special initiative, please, ladies and gentlemen. To moderate this session, may I please call upon stage Mr. Harbindan Narola, CEO, BW Healthcare World and BW Wellbeing World. Thank you, sir. And he'll be joined on stage by Shantanu Naidu, General Manager, Office of Mr. Ratan N. Tata and founder, Goodfellows. Loud cheers, please, ladies and gentlemen. Come on. Yes. We have the panel ready. Are you both ready, sir?
Yes, we are.
Perfect. Thank you.
Uh, how many of you in this room who know Shantanu or know of Shantanu? Awesome. You know, the first time I spoke with him was, I think, last year. And I was fascinated by his journey and what he was doing and what he was building. And what was fascinating was not just the business of what he was doing, it was the passion with which he started working on this. And, that is what drew me to try and learn more about him, more about his journey, and, the thought with which he began his journey. So that's what we're going to talk about today. So, Shantanu, your first business was not Goodfellows, right? But then Goodfellows happened, and then Mr. Ratan Tata chose to back you up with his money. And what I know of you today is that you are now, I mean, if I were to safely use the term, a good fellow to Mr. Ratan Tata. How did the idea of Goodfellows come into your mind?
A bit of it was circumstance, and a bit of it was my personal inclination, for which honestly there is no explanation. But I've always been affectionate towards the elderly community, anyone 60 plus. So if I walk into a room and I see a bunch of millennials, Gen Z, and I see a bunch of senior citizens sitting, I just gravitate towards them for some reason I cannot explain. But about the Goodfellows issue, I had senior citizen neighbors during COVID. I used to live in a small apartment in Kulaba, and I couldn't cook for my life. And I couldn't get to groceries at that time. It was the peak of COVID. And these neighbors, without even me communicating this issue with them, sort of knew what was going on. They were Mr. and Mrs. Punjabi. And every day they used to bring over a hot plate of food. And I always used to think by the end of COVID, how is it that I'm going to repay this particular favor? And I could give them only what I had in abundance at that time, which was time. So I started giving them a lot of time. I started hanging out at that place half the day, and I quickly realized that the change in their demeanor, the change in their energy, and what they were picking up from me was more of a cognitive need for them. And for what was for me a bonus activity was actually something they were looking forward to then every day. And Kolaba is full of southern Mumbai is full of senior citizens. And I thought to myself, this is just Mr. and Mrs. Punjabi. I just keep seeing senior citizens walk in and out of the building every day. And none of their sons and daughters are here in the country or are accessible. And that's because of circumstance and progression of whatever professional culture we have today. And that's not what we're going to talk about. But I quickly realized why limit this to Mr. and Mrs. Punjabi. So I analyzed to some extent, what is it that was making them so happy? And feeling relevant is such a challenge for senior citizens today because everybody here has talked about how quickly technology has progressed, albeit in the healthcare space, but it has progressed in every sense. And I, myself, as a 30-year-old, am so averse to now learning anything new that comes on that I can imagine how irrelevant and how outdated they must feel on a daily basis. So when a young person is constantly spending time with them, that relevance comes back in their life and they feel that, okay, there's still something to look forward to. So that's how the origin of Goodfellows came into being.
Do you see Goodfellows as a way of giving back to the society? Or do you see it as a passion project? Or do you see it as a business that you're trying to build?
I would take all those three boxes. And a passion, of course, because of reasons I mentioned. Giving back to society, more than giving back to society, I would say that this problem has arisen as circumstance as we have an aging population. In another 10 years, it's going to be a serious problem. We will be very close to Japan in terms of how many senior citizens we have. So this problem that has arisen out of circumstance, out of our societal progression in the country, is not to be put in the taboo category, or is not to be something to be afraid of, but to acknowledge it. First of all, we just acknowledge and say, we have senior citizens, their sons and daughters don't have the time. And we have to be able to acknowledge this without demonizing anybody, because that's not going to get us anywhere. We have this problem, we have to solve it. And this is one of the ways that we thought we could solve it. There is no companionship, we bring authentic companionship. So I wouldn't call it giving back to society as much as addressing an issue that is present and very much in our face. And in terms of business, excuse me. In terms of business, I think we are aiming for sustainability. I've spoken about this with you before. We are not looking to be a unicorn. We're not looking to raise valuation. If that happens as a byproduct of what we're doing, we're extremely grateful for it. But sustainability is something I'm definitely gunning for. And it's definitely not out of reach, because anything in society that you're trying to fix needs a business model today to sustain it and have the impact grow longer. Otherwise, it's always going to be a flash in the pan, where it comes in, hypes up quite a lot, solves it for a little bit, but can't live long.
No, absolutely agree with you, because the two things that actually come out of what you just said is that, one, the beginning is when you acknowledge that there is a problem that exists. And only when you acknowledge it would you want or make an effort to find a solution for it. And second is, every business or even a passion project for that matter, if it has to go and be run for over a period of time, it needs to be sustainable. Otherwise, there will be a time when you will give up. Shantanu, I remember when I was talking to you online and when you were pitching for this award, you mentioned that there were opportunities when the investors were wanting to put money in your project, and which you did not take in because you felt that you would need to compromise on certain principles with which you are running this venture. And the second thing was the hiring process of the good fellows. The process that you have seen work is a slow process. With these two things, which are based on your fundamental principles on which you run good fellows, how do you think you're going to scale this business at the speed at which you would wish to do so?
The answer to that is extremely slowly. And we are okay with that. We are essentially dealing with human emotions as a service. And without commoditizing it, which is a very fine line that you walk, because one step towards a financial goal or fiduciary duties might in fact turn out to be against the DNA of the company, which is in fact creating authentic and meaningful relationships. So yes, we have had interest from investors who, call it because of hype, because of PR, or because of genuine interest, wanted to invest in Goodfellows. But it was equally important for us to evaluate that for a business that has been built like a secret garden that you cultivate and grow slowly and with love and with empathy, because empathy is our central product. If you ask what is the central offering that Goodfellows has, I would call it empathy. Because every human capital that is recruited into the company is first vetted stringently for empathy. So we do scale slowly, especially given the process that you mentioned of finding empathetic people. And it's not that easy. I mean, I'm so happy that people have talked about empathy today in the medical field. But if you have to have empathy on a mass scale in the medical field or any field, it's just not that easy to mine, because you're literally handpicking people like diamonds. So how do you streamline this process? And the answer to that is you cannot. You can only make it slightly easier, and you can keep bringing in people, cultivating them, and looking for the raw material of empathy, and then building on that for human capital. So all these factors combined, there's just no way that I can scale quickly. I have 10,000 applications to be a good fellow in the last 1 year from across the country. I have 800 senior citizens who are looking to subscribe to the service tomorrow. But if I were to compromise on how I go about doing things and how we ensure that every relationship, every person is authentic, not superficial, and not scripted, then it's a loss if I went down that road. So I am happy with scaling slowly because that's what it means to maintain and protect that empathy. And the moment I go into the commercial flow, then it's a loss for everybody. So, yeah, I mean, anyone who is willing to be a part of this journey at the speed with which we are growing, because of the vision that we have, which in the end is to take care of our parents and grandparents, then we are definitely listening to you.
Shantanu, there was a time in my career when I was deliberating between my entrepreneurial opportunity that I had versus a beautiful job offer that I got from the corporate. And I went to my mentor and I asked him that, should I take up this opportunity, which is an entrepreneurial opportunity, or should I go in for this great corporate job, which pays me well, which is going to give me that next jump? And this mentor turned around and told me that, Harvinder, why this or this? Why not both? And that I felt was an answer that I was not expecting, but that changed the way I thought. Both you and I are lucky that we are getting an opportunity to do two things which otherwise is a choice for most people, right? But if this was not the case, how would you think the journey of Goodfellows have been if that was your full-time role?
Given the amount of time I'm spending after my day job with Goodfellows, there would be very little change or very little difference in commitment. But I have always, as soon as I've locked on to a problem to solve, especially a social problem, I've always first gone out and found a team that puts their skin in the game. And in the case of Goodfellows, skin in the game basically means feel the same way about the impact that we're creating in the way that I am feeling it. You won't get 100% 1:1 correlation, but if you can find people who are 70 to 80% there and who make the company their own, it allows you to do what I am doing and what you're doing today. So if I was in Goodfellows 100%, of course, my dependability on them would probably be less. We would be talking about more larger vision more quickly. But I am okay with what I have today. Like you said, it's a blessing. And I think Goodfellows remains to be a full-time thing. And my day job also remains to be a full-time thing. So I don't think I split time. It's just constantly two parallel lanes going on. And I'm blessed to have a mentor who encourages that and sees Goodfellows also as a managerial responsibility at the same time creating an impact that he himself is fond of.
And Shantanu, how do you think that tech, since we are in a conference which is talking of health tech, what is the role of technology that could be played in a business where empathy and human connect is the underlying fundamental of what is it that you want to create?
Right, that's a great question. And in senior care, we have so many age tech startups, as you call them, who are focused on making life easier for senior citizens. And of course, they're appreciated because they do want to make life easier. They want to make banking easier, etc. But the crux of the issue is with senior citizens and with all the elderly in our country will always be that they need someone to speak to and look forward to at the end of the day. They need that doorbell to ring. They need someone to walk in. They need the dependability of having human connection. And then you can make their lives easier. So as much as technology is a push from all directions, a lot of people ask us why we haven't entered into tech space yet. We will when we feel it's the right time, and we will definitely do it when we feel that we have established the foundation of human connection in all their lives, and now we can make it easier. So making it easier, there are a lot of people out there who are doing it. Maybe someday we will join them, but making their lives more filled with emotion, companionship, and their final years more forward to something, having something to look forward to. That's the goal of Goodfellows. So age tech can complement it in the future, but it's definitely not a necessity at Goodfellows.
And Shantanu, my last question to you before I let you go from the stage is that what has been your biggest learning from being a good fellow to Mr. Ratan Tata, and also from the learnings that came from other good fellows who've been there working with you in the last few years? What is that one or two big learnings that you have which you would want to share with all of us here today?
I wouldn't call it a learning, but I would call it an observation that an entire generation lies in our country ignored. And I don't blame the causation of that ignorance. But like I said at the beginning, and I would like to end with that, that we need to acknowledge that that ignorance exists because of the lifestyles we have, because of the changing social dynamics, be it closer to the West or be it strictly East, doesn't matter. The fact remains that we have an aging population that needs someone to speak to and validate their existence, because without that, their physical and mental health is deteriorating at 15% per year. The retirement syndrome today hits harder than ever because you don't have people in the family to rely on. So we need to take cognizance of the fact that a simple conversation or regular check-ins can make their lives turn around so much. And I've experienced this through my good fellows. I've experienced this through my own grandparents. And I submit to you that we should consciously make an effort to the extent where good fellows does not need to exist at all in the future. I would encourage that possibility that one day we just don't need my startup anymore.
Thank you so much for that last closing. My learning from listening to all the speakers who've been there since morning, one thing that emerges is, and this is something that, a lot of us used to talk about when we were talking of startups in the startup ecosystem a few years ago when that was a buzzword. It still is. But one realization is that when we are talking of technology, whether it is technology in whatever domain or health tech as we see today, the underlying belief, the intent with which we want to do something can be enhanced and be enabled by technology. But technology cannot take away the intent and the belief of whatever you are wanting to create. And that's been my observation of today. And thank you so much, Shantanu, for your time. And thank you so much for being here in person.
Thank you for having me. It's a privilege. Thank you.
Thank you so much for this lovely session. Loving the cheers. And Shantanu must say, if I'm allowed to use the word again, you're such a good fellow. Genuinely, and I love that hair. It adds to your charm. Can we have the memento, please, for Shantanu, and then we can have the group photo. Loud round of cheers, ladies and gentlemen, as we have the photos. Thank you so much. In today's event, I would say one word that has often been used is COVID. Of course, we know how the dynamics changed pre and post-COVID, and not just in people's personal life, professional life, in every way. COVID has played a huge role in people's lives and how people operate. I'm sure it's the same in the medical sector as well. Diagnostics have also changed, and I think we right now have a viewpoint on the subject, diagnostics post-COVID, how technology is playing a role. For this, may I please call upon stage Dr. Velumani, creator Thyrocare, to share his insights and valuable points on the stage. Thank you so much, sir. Welcome. Stage is all yours, sir.
Good afternoon. I am an old man. Good fellow, please note it. I'm an old, bald, bold man, and I have sold what I created also. So Arvinder asked me, can you come and give a 15-minute talk? I loved it, the invitation. So since I'm in Bangalore, I thought I should come. And then afterwards he added, it should be towards health tech. Now I am an old man who started a business in days of pager, no SMS. 1995, no internet. My web server was the oldest web server in the entire healthcare industry. Fortunately, I was a mathematician. So for me, bit easy for taming computers. There was no word entrepreneur. There was no word venture capitalist. There was no pitching happening. And there was no itching to do the pitching. So that's the 30 years back I started the business. And I made it very loud and straight. And I scaled the business so powerful. Today, I keep telling wherever I go one punchline. Scale nahi to kale nahi. So to that extent, I built the business. And yeah, I have to connect with health tech. So I must do that. And I am known for telling punchlines. So out of time given, I will use 2-3 minutes to tell initially itself some of my punchlines. जो काम करते हैं वो बुड्ढे होते हैं, जो काम कराते हैं वो बड़े होते हैं. So I have to tell it to medical community because medical community बहुत काम करते हैं, काम कराते नहीं है. So this is one point I thought I will tell you. जो जीतता है शायद हार सकता है, लेकिन जो जिताता है वो कभी हारता नहीं है. So I created 1,000 millionaires to become a $1 billion company. So you have to create successful people around you. In life, you can either discuss or you can decide. You can't do both. Very often, unfortunately, people start discussing. And especially they discuss with the family members. If you discuss with family members, no decision can be taken. So please take decisions. There are only two kinds of people. One is successful, other did not take decisions. So let me tell you, those days, there was only microscope in a laboratory. I will deal with only diagnostics. I won't be talking about entire health tech. And only microscope was there. One calorimeter was there. And in radiology side, one X-ray was there. This is all when I'm talking in before 1975. There were no automations. There was nothing. Even pipetting was done using mouth. Then came a small bulb. Then came micropipette. Then came auto pipetting system. Then came automated calculation of values and results. Then came multi-analyte connected track system to give you the results. So this is a journey of last 30 years. I'm old man, so I have seen the other side also. And today I'm seeing totally different world. Immunoassays came first. 1959, first immunoassays was reported. That was the year I was born. And they completely changed estimation of hormones, proteins, enzymes, peptides, cancer markers, tumor and cardiac markers, all could be established. So that is where diagnostic field started becoming visible and also potential. Cell counters came only after 80s and 90s. Before that, it was all through microscope. You have to count. There was nothing else. Today, the machine is producing every 3 minutes, 4 minutes, one result. Automatically counts everything error-free, and that is connected to the server so that there is no typographical error also. This is heaven. I was then. So you must know, people today ask me, how did you scale up in a day when social media was not existing? Trust me, there was a journey, and that journey was, those days, competition was less, opportunities were more. Today, opportunities are also more, competition also is more. PCR, that is ATGC, that the 4 peptides are what you call as nucleotides, was introduced as early as 80s. But till COVID came, no one knew what is the full form of PCR. Now everybody knows what is even antibody. To that extent, COVID has completely changed. And then Sequencing has become today need because every day the COVID is changing its configuration. So any change in the variant can likely to put us once again in the back step of lockdown and sit in balcony and gatti bajao. So this fear has come. So technologies are now growing faster. Sequencing is now improving. HPLC has come inside. LCMS has come inside. Trust me, laboratory technologies have been growing very, very, very slow. There's nothing truly exciting has been happening. I used to tell it. That time my peers used to did not like it. Now have exited the business, so I can loudly tell. Cloud has changed the complete picture. We have laboratories in 10 different countries controlled by a single cloud, which means quality is controlled, speed is controlled, everything is controlled. So cloud has come and completely helped to scale. And let me tell you, I was the first man to put a barcode on a test tube. This was done in 2002. Until that time, that no one could imagine that laboratory can be completely automated. So the test tubes carried a barcode, and the barcode was dispatched to throughout the country, all places where blood is collected. Trust me, in our laboratory, we have never done a data entry, never printed a report. All was done remotely from Trivandrum or from Amritsar by man who was sitting locally. So this kind of change was brought in year 2005 itself in laboratory technology. Otherwise, in a night, 400,000 investigations before early morning 6 o'clock could not have been reported. It was silently happening, and I became the leader in that space because I adopted technology. And trust me, it was not my peers' fault. They were doing histopathology that is not amenable to technology. They were doing microbiology that was not amenable to technology. It was only biochemistry, which was numerical pathology, which could be connected to the server and it could be scaled up. Fortunately, I did PhD in thyroid, because of which I did only thyroid. The name Thyrocare itself said all in thyroid, only thyroid. And I am very proud to tell I was the first man to build a brand around a gland. 15 grams of a gland, which made me to create $1 billion business. अभी तक थायराइड में कोई मरा ही नहीं है, उसमें भी मैं एक यूनिकॉर्न बना डाला. Healthcare is very powerful. Technologies can create huge trillions of brands worth it. Similarly, the other side, from X-ray, first came was ultrasound in early 70s, then came CT, early 80s, then came MRI, late 80s, then came PET CT in early 90s, and trust me, उसका बाद कुछ आया ही नहीं है. Literally speaking, these are the technologies which have been useful, and point of care testing is happening. Let me tell you, lot of startups have started focusing on various aspects of health technology, but it is not that simple. Health is a complicated subject. Maths, physics, chemistry. Physics is understood. Chemistry is understood. Physics, whatever my grandfather studied, Ohm's law has not changed to my grandson. The periodic table has not changed. The number of elements in periodic table has not changed for 4 generations. Mathematics is controlling physics, and and chemistry gives rise to biology. But biology has so much of variation. No two individuals are same. No two cancers are same. Trust me, it's going to be a very big challenge for people to get into and do disruptions in health. or 2075, but it's going to be a long journey. It's not a 100-meter race, it's a marathon race. AI and ML, yes, these two are going to rule. People are scared, but there is no need to be scared. In early 80s, State Bank of India employees went for 2 days of strike because computers were introduced. Now, if you take the computer out, they will all resign and go home. So this is how technology gives you fear. I am pretty sure it will help. And the biggest problem today is the radiologist and the pathologist in diagnostics. Let me explain you why. वो लोग डर रहे हैं, अगर मशीन पूरा काम कर लेगा तो मेरा क्या होएगा? So this is the problem. That is the block. There are plenty of solutions available in that domain. And I'm pretty sure by next 10 years, 20 years, it will do great work. And I was quite happy to hear good fellow didn't want any money because he says funding nahi chahiye. I must tell you here, there is a punchline. If you think not having money is the only problem, when it comes, it will be the only problem. So please be careful. Never money comes free of cost. I did a business, some unique parameters in my business I will highlight. It is 27 years which took for me to reach there. Company never borrowed. Not even a single dollar has come inside the company as an investment. Zero investment company. Trust me, I employed only freshers. I employed 25,000 freshers, trained them to retain 2,500 employees, and I have never taken an experience from anywhere else. Company was doing, in entire healthcare, India is cheapest. In entire India, I was the cheapest, and yet my balance sheet had 40% EBITDA. To that extent, that was the powerful journey. That gives rise to punchline. Profit should never come from customer's pocket. It should come from the floor efficiency. Create a floor which is highly efficient. You will be the most powerful man. You know why radiology is still costly? Because in radiology, machines are standing for 14 hours in a day and working only for 10 hours in a day. Uber as a concept is 20 hours running, 4 hours standing. Until I came into picture, thyroid testing machines were only running 2 hours in a day. I made sure that they run 24 hours in a day. So that is how prosperity can be created. Since it is a medical community who are sitting here, I am even forced to tell one more punchline. A multi-speciality is a short-term security. A multi-speciality is a short-term security. A single speciality is a long-term prosperity. It takes time to build. And I had courage to start on thyroid with 3 tests, T3, T4, TSH. लोग पूछा था इसमें क्या रोटी मिलेगा क्या? मैंने बोला 125 करोड़ thyroid मेरा ही है. So that's how I created a business. I wish to thank Anurag Batra always because he likes me talking and energizing people. So I come, and when Arbinder called me, I must come and I must enjoy. I'm going to be around for some more time. We'll be happy to share some more punchlines if you come around. Thank you very much. God bless you.
Thank you, sir. Love those punchlines. I have a line for you as well. You are the first of so many things. अमिताभ बच्चन का एक डायलॉग इज वेरी जस्टिफाइड फॉर यू. हम जहां खड़े होते हैं लाइन वहीं से चालू हो जाती है. I have that Bollywood connect, so I can say that for you. Seeing you, so many people have followed and have been inspired. So thank you so much for inspiring a whole generation. Pleasure, sir. I'll just request you, sir, to be on stage. Harbinder sir will be coming to give the memento. Are we ready with the memento, please? Please welcome Harbinder sir on stage. Let's have the photo going in. क्या बात है. And sir, don't be surprised when after the event people surround you for punchlines. All right, really interesting viewpoint indeed. Time for an insightful panel discussion. Before that, I'll just quickly give them some time to set up the panel. Are they of equal distance from each other? That's the focus, I think that was, right? You don't have to genuinely say, I'm just kidding, don't worry. So the next panel discussion right now, the subject is role of technology in regulating pharma supply chain. This panel discussion widely covers the aspect of pharmacovigilance, role of technology in curbing malpractices like counterfeiting, fake medications, etc. To moderate this session, may I please call upon stage Darpan Roy Chaudhary, co-founder and COO, Air Savir. Hello, sir. Welcome. Cheers, please, when we have people on stage. It only motivates them for a really insightful session going forward. Louder, please. I'll request Rahul Adakmol, COO, International Business, BSB, to join us over here as well. Hi, sir. Welcome. And Sanjana, if I can have an update regarding... she's joining us. Okay, so we have Anubha Dikshit, founder and CEO, Tonga Live. She'll be joining us virtually. Hello, ma'am. Pleasure.
Hello.
Also, a lovely session. So the stage is all yours. Please go ahead. Looking forward. Thank you. I'm so sorry. I'm so sorry. Apologies. We have Nakul Pastricha as well, President and CEO, Pharma Secure and President, Authentication Solution Providers Association. Really sorry, sir. So now I believe we are finally set. Ready? Thank you.
Before we begin, just one small request. I know we're all very excited to meet new people here, but if we could avoid congregations at the back, because I know it feels far away, but really I think it disturbs the speakers. So if we could avoid that, that'd be great. Let's get started. Welcome to everyone, and ma'am as well, out back.
Thank you.
So I think before we get into it, I will address these questions individually to whom I think they're best directed to. But in the best interest of the audience, I think let's all jump in wherever we have opinions and keep it open. So we know that in India, counterfeiting is an issue across various industries, not just in health, but in healthcare, perhaps it represents a different kind of risk where life-saving medications are being counterfeited and things like that, where the risk to society is simply much greater than in many other industries. So Rahul sir, your organization specializes in things that are very often life-saving and are the difference between life and death, and have been, especially we went through a pandemic in those kinds of situations. Bharat Serums played maybe reminded us of a much more important role. So maybe you can set the tone for, what is really the problems that we face in the industry, within the supply chain, who is affected and how when it comes to things like counterfeiting. What is this challenge ahead of us?
Yeah, so thank you for having me here. It's a privilege. So imagine a situation where, some of your near one is really in a hospital and need of a life-saving drug. And the person is given medicine, but the medicine really doesn't have a medicine in it, and we often think that, this is not my problem, this is somebody else's problem. But I can tell you that some of these kind of serious issues like counterfeits are fairly prevalent, not only in India but globally, and the magnitude is very, very substantial. For example, some few years back, WHO did kind of an analysis from almost like 75 low and middle income countries based on their lab reports and the medicine testing, and they found that at a country level, almost like 10 to 15% medicines are either counterfeit or they are deficient. Now that number is quite huge, and imagine what happens, the implication of a counterfeit drug, right? Even in high income countries, that number is close to 1 to 2%. Now, when that type of thing happens, I mean, look at the health impact of that. Same WHO, kind of in one of its reports says that because of if patients globally, there were about, kind of patients who were suffering from malaria or that for that matter, pneumonia, almost 1 lakh additional deaths occurred because those patients by something received counterfeit medicines. 1 lakh deaths, right? And I still would like to believe that that number is still underreported because a lot of, kind of those cases are not detected. But that's the kind of magnitude we are really talking about. And we have seen that you talked about India. Even in India, I mean, from all practical point of view, when we get, as a company, we have a very strong pharmacovigilance network. We get reports about, kind of some patient safety related issues, etc. And when our team does the analysis of that situation, you would realize that often that is attributable to a kind of a fake medicine or a counterfeit. This problem I have seen, I represent international operations for Bharat Serum. I've seen that happening in, kind of Southeast Asia, that is happening in Africa, Latin America, across, that is happening across, right? So it's really a global problem to me. The implications are serious. And that's why many countries have made this as a kind of criminal offense. And there is a kind of concerted efforts which are going on worldwide against it. In some cases, even Interpol is involved, kind of curbing some of these things. So this is a serious problem to me. And I think, I wish none of us sitting here or worldwide should get counterfeit medicines when they are really in dire need of medicines.
No, I appreciate the reorienting of it really being a global issue. From your experience, you've definitely seen. I have definitely seen during my time in pharmaceuticals these kinds of reports come up where it was later found that this was purely a counterfeit or a spurious drug, and it's definitely a big problem, which then turns me to Anubha ma'am and Nakul sir. You're both in the business of helping us prevent these kinds of issues in society. You both have founded companies that try to deliver technology to manufacturers and other parts of the supply chain that can prevent this kind of catastrophe. So it goes to both of you. Dr. Velumani sir was telling us about the progression of technology in diagnostics. Could we have a quick dive into the progression of technologies when it comes to authentications within the pharma supply chain? Where have we come and where are we heading to? What's exciting? What might be a couple of the game changers? Nakul sir, if you want to go first.
Thanks. I think Rahul laid out very clearly. Is my mic on? Rahul laid out very clearly and very well, the problem of counterfeiting. I will just add one statistic that struck me. There was a report released by the UN that said about 500,000, 500,000 people in sub-Saharan Africa died because of substandard or fake medicines. I think it was in 2021 that the data was from. And in the equivalent year, I looked up WHO statistics. The number of people that died from COVID was 280,000. Now you think about how seriously and rightly so the world took COVID, and what are we doing about this problem, I think is something to think about. But I'll address the question that you asked. in 2011, the Indian government, I'm very proud to say, was one of the pioneers in terms of protecting the exports going out from India through the use of barcoding or serialization, as it's called in the industry. Essentially putting a unique code on each medicine that is exported from India, so that it can be identified as having come from India, and so that the government can actually track the exports a little better, and assure basically the world, with the pharmacy to the world, assure the countries that we're exporting to that we are taking this seriously and we are implementing solutions. We were one of the pioneers. Unfortunately, due to various reasons, it took until 2023 for us to start protecting our own patients. But as I'm not quite as good as Dr. Velumani, but what do they say? Derai, but Drustai, right? So from August 1st, 2023, the top 300 brands by sales in India, and many of those, I guarantee you, if you go back to your homes, you will have at least one of these medicines somewhere in the house. We have QR codes that can be used to verify that the medicine that you're buying is genuine, and to get some additional information about the product. So technology is kind of coming to help protect people. Right now it's the top 300 brands. I'm sure it will be expanded in the coming years. This can also be tied into the technologies that we all know very well, like blockchain to secure the supply chain. AI can be used to detect anomalies in terms of some of the distribution. There can be some other physical features that are already there that can be kind of tied in to the package. There are different kinds of technologies, even at the nanoparticle. Even I was talking to a company at the quantum level. I don't know how they do it. Maybe it's more of a marketing thing, but at the quantum level is what they say that can be used to kind of protect packages. So there are various technologies available, and I'm quite sure that with the right regulations and with the right kind of adoption of technology, that we are going to be able to make inroads into this deadly problem in the coming years.
Thank you, sir. Ma'am, we'll hear from you.
Yeah, sure. Thank you, first of all, Businessworld, to give the stage and to invite me. Now, coming back, and I'll start again with the scale of the problem. There are some reports which do suggest that counterfeiting industry is around $200 billion in industry. So that is the kind of scale we are looking at. Now, coming back onto the regulatory compliances, and especially if we say it in pharma supply chain, it's all about visibility, control, and for public good. Yeah. So now coming back, what technology solutions are considered by the industry? If we say serialization, or it is also known as track and trace, traceability, L4, it has become the foundation. It basically gives a unique ID to each individual product item. And what we see is the technologies are available, the ecosystem are available now. For example, like blockchain, which can give that inherent trustworthiness or immutability to the data. So even the creator of the data cannot change that particular data. Coming back to AI, as we say, it can actually, what I see, the immediate use case, which actually it can help in supply chain, whether it's pharma or outside pharmaceutical domain, predictive analytics, just-in-time inventory management. And that's where AI can come in. Cloud technologies, I would say that is really helping, which can help give a network effect, the interconnectivity, because supply chain has diverse, stakeholders across the globe. So cloud technologies, with SaaS-based pay-as-you-go models, it can actually reach to SMEs as well. And then IoT, when it will be commoditized, I can just say it will give us a real-time, tracking of the system.
Thank you. Thank you so much. You rightly, I think, pointed out that it's an ecosystem of stakeholders. You can't solve the problem by just entering any one part of the chain, as is often the case with a mature and sophisticated supply chain like pharma. So Rahul sir, as a manufacturer and as a marketer, someone directly in the chain, during my time, for example, in pharmaceuticals, what I would hear is that this, outside of all the technological advancements that a manufacturer has at their disposal, which is, provided that they can afford it, they can execute it in most cases. Outside of that, there is, in counterfeiting specifically, there's a criminal activity involved, which is the business of the lawmakers, the government, those kinds of bodies where really a manufacturer cannot play a role. And that often was the complaint that used to come up, that, we could do all these things, but if someone figures out a way to, shove a product into that chain somewhere and they have bad actors on their side, then in that short period of time, there's very little that the manufacturer can do. So what kind of support do you think that different actors in the supply chain, whether it be manufacturers, it be retailers, it be stockists and distributors, what kind of support do you think can be given, and from whom, in order for it to be truly an ecosystem-wide effort that people are collaborating on and they're not left out to dry one way or another?
Yeah, so no, I agree that this is a big problem to tackle. This is not an easy problem to tackle, first of all. Second is no one single entity like a manufacturer or kind of HCPs or hospitals for that matter, or even patient bodies can kind of address that on their own in isolation. So there has to be a kind of a joint or collaborative effort. I would tell you one example. I mean, how we did that. And that would give you the idea. I mean, and I'm talking about something which happened in one of our markets in Philippines, right? One of our anti-rabies medicine, we were constantly getting complaints about the product quality, etc. And when we investigated, we really found that it is because of the spurious medicines which were getting imported in the country and were, kind of distributed. And that's the time I think we activated all the possible channels there. And first and most important channel in this is the regulatory body. You have to activate the regulatory body first because it is related to the patient safety, right? So basis our investigation on the batch numbers, etc., which were involved, and we had a clear evidence that these were not the batch numbers which were manufactured by us. The first, kind of stakeholder there is a regulatory body, and we, kind of involved in it. Second is important piece there is, I would say, the law enforcement agencies. You have to involve law enforcement agencies because it's a criminal offense, right? And hence, I think that is the second stakeholder we activated. And it went on to the extent that with the help of local police, etc., there were raids made on certain warehouses, etc. There were some online, kind of channels through which these medicines were being sold, and all of those were blocked. And many cases they were actually went ahead and did the raids. Third important stakeholder in that whole thing is, kind of your HCP and that whole community. Creating awareness about the spurious medicines, counterfeits, letting them know that it is happening on particular aspects, in particular areas, in particular products, in particular disease areas. And we had to really, and thanks to our team there, we had to actually conduct a lot of kind of seminars involving multiple stakeholders to really talk about this at a different level. And of course, then your other important stakeholder, and when I'm talking only from our point of view, is your own employees and your pharmacovigilance team, which is really kind of extremely vigilant about where are we kind of seeing these type of complaints coming from. And you would see many times there are certain geographical pockets you will start getting these type of complaints, and you have to be extremely vigilant about this thing. Sometimes they could be of genuine thing, but more often than less, I've seen that it has been attributed to this type of things. So all 4-5 stakeholders and channels one need to activate to address this. And to a large extent, we are able to kind of give a good counter push to what we saw as a problem. But as I said, I mean, this is one of the initiative by one of the companies for one of the product in one of the country. I mean, look at the magnitude we are really talking about, and hence I think it is important that the broader set of people and the community and kind of all of these stakeholders need to be aware and kind of be taking actions against it.
Thank you. Very well put. Anubha ma'am, I have a bit of a selfish question for you. I'm just going to slide my own experience in there. So I run a company where we make consumer healthcare products, right? They're not prescription drugs, but they are meant to help you with certain conditions. But as entrepreneurs, we're sort of intrinsically optimistic. We're working on how to make the product have IP, make the product difficult to make the product hard to replicate. But we really at the get-go, at those early stages, we pay no mind to something like counterfeiting or preventing down the line these kinds of issues. We think of that as an at-scale problem. If my brand is not big enough, then it's not my problem. I'll only get to that when I sort of have people who are trying to emulate me and get away with that. So how can young companies, startup founders, there's a room full of them here, how can they bring that mindset into their products from day one, rather than that be something that they consider way down the line?
Okay. I'll first start answering that counterfeiting is just not about fake goods. They can actually even say diversion. Your product is diverted to another market where it is not supposed to be there. So this is again an additional this thing. And when you are starting up a company, the last thing you would like to have is the kind of reputational risk. So when this kind of technology or the kind of serialization or track and trace system, or when the technologies are in hand, I would rather suggest the first thing every startup should be looking at, rather than taking it as a cost, they should be looking at that it will actually mitigate their reputational risk. Having said that, as I said, that we have cloud technologies, and for SMEs and for micro and small, medium-sized players, we can come up with a model like pay as you go. So you don't need upfront capex to invest in. So that's the kind of mindset we really need to change. Don't look it as a cost. Look it as an investment where you'll get a return here. Especially in serialization, you will get to know if there is a full traceability or a full visibility of your supply chain. You can have just-in-time inventory management, which will again reduce your cost. Basically, it will make you an efficient, actually, kind of a manufacturer if you are looking from a manufacturing point of view. So you use the technologies which are in hand. The ecosystem is there. A couple of years back, they weren't there. And I think 2017, 2018, when we saw AI, cloud, and blockchain coming into picture, utilize that. And we don't need a lot of investment to go for it. And there are quite a few players in serialization who can come up with some kind of a business model for startups as well.
I'll just take a minute. I think Anubha raised a very important point about this parallel export of medicines. Now, many times these are not spurious medicines. These are exported to countries and regions where they are not supposed to be, kind of thing. And the real problem, I think I completely agree with her that it's a reputational risk, because these are your medicines under your brand, which are being sold in country where they are not made. Now, what is the risk? The risk is really, now imagine some of the cold chain products, they need to be maintained in a tight, kind of temperature range. What is the guarantee they are maintained in that way? And when the medicines are not maintained in that way, they lose their efficacy. They become spurious because they are not maintained in that way. And this is again a big problem, actually, this whole parallel export, which happens from, kind of countries which are very strong manufacturing hubs. And I'm saying, India is also one of such country. China is another such country. That a lot of parallel export happens, and it really has, no control on the supply chain, which causes the, kind of medicines losing their potency and really causing, kind of health hazard.
No, those are great points. I think the investment rather than expense approach, it speaks to youngsters today also, because we are a generation that values brand reputation. I think fairly early on, that maturity has sort of hit young entrepreneurs, at least in India. That's always being discussed, that I don't want the wrong idea. So I know my colleagues are watching from home, so take note, Team Eraserware. But before we close out the discussion, Nakul sir, I want to ask, everybody here is involved in healthcare in one form or another, but perhaps the real common denominator for all of us is that at some point or the other, we're all patients. And we're the consumers of these end products, right? So consumers always have a role in accelerating any kind of change towards social good. So what can we do as the average person who goes and buys some medicines and uses those on a daily basis? What can we do in that role to try and accelerate the progress of all kinds of technology, whether it be in track and trace or whether it be something we haven't even heard of? What can we do as consumers for the cause?
Yeah, I think that's a very important point. Through the association that I chair, the Authentication Solution Providers Association, we did a study in partnership with CRISIL earlier this year, and what we found was that 89% of consumers are aware that there are counterfeits in the market. This was a cross-sector study, but we also drilled down into a few sectors, including pharma. 89% are aware that there are counterfeits in the market, but 30% willingly, knowing that there are counterfeits, are buying them. So that's the first thing that I think we need to do. Now, granted, most of these consumers, when asked, are you willingly buying fake medicines? Obviously, most of them thankfully said no. But in some other sectors, people are willingly buying. So I think as consumers, we need to understand that buying a fake product, whatever it might be, it's not just harmless. It is something that is impacting. It could have harmful chemicals that will impact you in medicines. Certainly, that is a serious risk that you must consider, even if it is OTC products. Secondly, even if there's no kind of medical harm, there is harm that's happening to the economy. The government of India loses, I think, lakhs of crores in terms of lost taxes. And that is going towards kind of building up our economy. So by buying counterfeits, we are kind of contributing to the problem. So we need to be aware that it is not harmless. There is harm that is happening to ourselves and potentially to the country. Secondly, we must kind of know our rights. I mean, we have to get a bill when we buy a medicine. It has to have the batch number on it. We should be able to look at it. We should be able to see the expiry date. If you cannot see the expiry date, that is a problem. And certainly where there are kind of problems, you must report it back to the company or to the drug regulator. I mean, there are kind of channels available. Obviously, Ministry of Consumer Affairs is always there to listen to consumers. And lastly, when the government does implement regulations, like I said, the QR coding, please, I hope everyone will be aware of this, and I guarantee you, amongst the medicines that you commonly use, at least one is going to be in the top 300, and you'll start seeing the QR codes on them. Scan them, use them. The government is taking an initiative. We must kind of use it, because these kinds of systems, the more you use it, the more data it will generate, and the greater insights and the more the protection that the government will be able to give you and manufacturers will be able to give you in order to stamp out the problem. So that's my earnest wish for consumers, and hopefully we'll all kind of tackle this together.
I think that that's a great note to end on. Unless anyone has any concluding remarks, we got a little tip as to what we can do as the immediate next step as consumers. And I personally look forward to being able to scan lots of QRs and see what's on the other end of that. So thank you to all the panelists for your opinions, your expertise, much appreciated. And we look forward to much more of this tech in our supply chains very, very soon.
Thank you so much, respected speakers and panelists. May I please call upon stage Sunil Khurana, Managing Director, BPL Technologies, to come up on stage to present the memento. Are we ready with the memento? It's a token of appreciation gesture. Talia, ladies and gentlemen, please. Loud cheers. We must have a photo of all four of you posing together. Yeah, ma'am as well, so I hope you're taking keeping her in the frame as well. So thank you, ma'am, for joining us virtually. All right, the final discussion before we go ahead with some other exciting stuff for the evening. We talk about social media, ladies and gentlemen. Everybody, I believe, is on Instagram, on Facebook. We're always scrolling on our phones, swapping through reels, etc. So the impact of social media is, I believe, it cannot be ignored. It's very, very important in everyone's life. But it's also about making it productive and useful in the best way possible. So that's where we talk about creating awareness in healthcare using the tool of social media. The topic for the moment is In Focus, the saga of social media. This is about the new age marketing tool that has helped in creating better reach. The panel will touch base the very essence of social media being an effective tool in creating awareness in healthcare. Are we ready with the panel? Setup is ready? Sorted? Okay. So to begin with, may I please call upon stage Dr. Ashish Bajaj, CMO, Narayana Health, on stage. Welcome, sir. May I please have Mr. Harsh Kedia, Diabetic Chief, Conscious Mithaiwala, on stage, please. Loud cheers. Come on, ladies and gentlemen. Loving it. Ms. Kripa Jalan, founder, Burgers to Beasts. Love that name. And the session will be moderated by none other than Mr. Harbinder Narula, CEO, BW Healthcare World and Wellbeing World. Thank you, respected moderators and speakers. Are you ready and sorted? Thank you so much. Please take it.
To sit with influencers had I not been there moderating this session. So thank you so much for this opportunity to Businessworld. Acknowledge this opportunity that I have to be able to speak to such wonderful people. Harsh, was our 40 under 40 winner, and 30 under 30 winner in our BW Wellbeing World, which is another community that we, which is a very strong community that we have at Businessworld. And Kripa is our winner for this year, 30 under 30 for healthcare, and we also have a very experienced marketer who has been in non-healthcare domain but is leading one of the marketing activities at Narayana Health. So thank you so much for Ashish for taking our time. And it's a very interesting thing when we are talking of healthcare, and I'm not talking of well-being alone, but healthcare. Somehow social media does not come into our mind. We always see it as a very serious, dull domain. And the marketing does not usually include social media. So that's the point that we are going to be talking of today. And Harsh, I want to speak to you first, because
always
I'm diabetic and I love sweets. And what he does is really fun and nice, and looking forward to more of what you do. But Harsh, what do you think? And how do you think social media is an important part of healthcare marketers' strategy today?
Firstly, I'd like to thank BW Businessworld and you, of course, and the entire team to invite me again to the event, and now I'm a speaker here, so it's very honorable for me. Coming to Diabetic Chef, I've been running the name Diabetic Chef. This is our decade anniversary. We complete 10 years in November. I was a total of 16 years old when I started it in school. And my idea with Diabetic Chef is education only. It never seemed like a business idea for me. It never seemed like I wanted to make money off it. But a very popular quote that I read and heard of in Batman was, if you're good at something, don't do it for free. So then I decided to start making money off it by selling products. But again, I feel that because there are so many restrictions with medicine and advertising. I feel social media has a lot of surrogate ways of advertising and advocating ideas, medicine, and the right knowledge you need, especially for a health ailment like diabetes. I feel when we do campaigns for brands, like I work with I worked with all insurance brands. So if you see like a Bajaj, or you see like a AIG, or you see like an ADF, trust me, I don't do it for the money. I do it to fund the business that does good work. But the way we market these insurances is by giving you quick recipes, or by doing awareness things like 5 reasons why diabetes may affect you post your 30s, or why is it coming early, or millets are good for you, etc. So I feel social media has been a great medium of communication and sort of putting the word out there to maybe not directly scare people, which was something that 10 years back was done. So 10 years back, when I was diagnosed, my doctor said, I'll chop your feet, I'll chop your hands if you don't control your glucose levels. And that is how diabetic people were treated. And today I'm like, I'm going to give you something your doctors have told you for 20, 30 years you can't eat. I'm giving you mithai. I'm giving you that mithas in life. While we educate our audiences that this is not processed sugar, etc. So yes, that's it from me. Thank you so much.
Ashish, let me come to you. Normally, I'm breaking the protocol of, instead of asking the question to a lady first, she's going to be the last one to answer this. So Ashish, since we're talking of social media, and what I was talking of earlier was that it's very difficult to relate social media to something as serious as healthcare. How do you see the use of social media when you are running an institution like Narayana Health?
So, Arvind sir, the point here is that how you're utilizing the platform is the beauty. Why? Because healthcare or hospitals are treated like I'm dread going there. I don't feel, because tomorrow morning I'm not going to get up and say I'm going to go to the hospital. Right? So how do you the person who's already under pressure, under tension, kind of utilize that medium or platform to reduce their stress? That I can also go visit a hospital. And I'll quote what Dr. Shetty loves to say is, you should go see your doctor and you're absolutely fine. That is the right thing. Now coming back to the point saying that how does the social media work? See, the importance comes out that when I'm going to go there, nobody's going to put me on the bed. That is the kind of the simplicity of the message that we need to solve with the platform. And if we are able to do that with the help of influencers, that I think is the jackpot. For somebody as serious as business into healthcare, which is hospitals where you're treating lives.
Kripa, let me come to you. Your channel on Instagram, your handle on Instagram is popularly known as Burgers to Beasts, right? And since Ashish mentioned the word influencer, my question to you is, when we're looking at social media influencers, there are a lot of people talking about healthcare, a lot of people talking about well-being. Many of them themselves are not qualified to share this information. And healthcare is a very serious thing when it comes to what is it that you're saying and the acceptability of what is being said. How do you differentiate between a healthcare influencer and a healthcare enthusiast, healthcare practitioner? And what is the kind of responsibility that you think these people need to have when they're on social media talking of something which could be, impacting other people's lives?
I think that's a great question, and I think social media is a double-edged sword. On one hand, it's given rise to rapid dissemination of information, and it's given everyone a voice. But on the other hand, it's given rise to rapid dissemination of information and given everyone a voice. The important thing to note with social media is a lot of the content is posted for engagement and not education. So it's perfectly fine if an influencer or a user is posting their wellness routine, their skincare routine, drinking more water, moving more, eating more vegetables. That's baseline recommendations. So long as they're not advising others to do the same, because I think individuals are unique and their care should be too. Now what happens is typically when users hop onto social media, they see these routines and they say, hey, maybe I should try it too. Again, baseline recommendation, great. But if influencers don't have the right credentials to offer advice, I think they should pretty much refrain from making content about important topics like type 2 diabetes education, pros and cons of intermittent fasting, and leave that to the experts, because I think that lends a little bit more authenticity, and it's more likely that that advice will be research backed than based on headlines.
Tell me one, yeah.
If I may add to it. So we are speaking about, it's not working. So we are speaking about type of influencers. What about a healthcare brand itself being the influencer? That can also be an opportunity.
Absolutely.
Why I picked up the conversation, a YouTube channel or a Facebook channel are the biggest in the industry. We have the largest following. And just Kripat, adding to your point, if the education is correct, the engagement will come. So I think if you have to balance those two, I think healthcare brand itself can be the influencer.
Ashish, you've brought up a very beautiful point, and let me ask you this next question: that why can't healthcare practitioners, doctors, become influencers?
Absolutely, absolutely, yes.
How do you do that? I mean, are you doing this, and how?
So, of course, after exchanging that, you need the blue ticks. We've got the blue ticks as well. And not only that, you won't imagine the power of information that they have, which needs to reach out to people, is immense. Imagine they had just arm's length of their information going to. Now imagine their reach becoming so much. And there are enough already medical practitioners who are big names in the social industry in terms of they being influential. And that is what our intent is also. So let's have a replica of this in the offline world, how it used to be earlier. Our doctors being the influencers at a ground level when we all are sitting like this. Now we're changing the medium and they do a fabulous job.
So, Kripa, let me come to you because, in fact, you and Harsh both can, share your thoughts on this. It's easy to say that, a doctor should become an influencer because one of the realities of social media is that you need engagement. And it is tough to engage people on media. It's really, really tough. Which means the doctors have to come out and do something or bring out a different aspect of their personality. What is your insight on this? What do you think? Is it good for a doctor to do this? I would not say good. Is it okay for a doctor to bring out that side of a personality, or would it actually be detrimental to his practice and what people think of him or her?
Absolutely. So I think social media is no longer just pretty pictures and fun posts. It's an integral part of how we communicate and even how we work today. There's hundreds of millions of users spread across different platforms, and it's safe to say several of them are businesses or even practitioners. But it's also easy to get lost in the mix. I remember this one quote that said, people don't buy what you do, they buy why you do what you do. And I think social media is a great way to communicate that with your messaging, your tone, your imaging, and staying true to yourself while doing so. Because sometimes you create content for the masses, and then it's just like every other post. But I feel like if you're able to really stick to your guns and put yourself out there, you'll find your community within this massive sea. I think it's very, very helpful for healthcare practitioners. I'm a nutritionist, not a doctor. But I've been able to find my community on Instagram, on YouTube, and really speak to them. It's not really about the likes for me, it's about how many people can I get through to that. Can I make an impact on 2 out of the 100 people that have liked my post versus just get 200,000 likes and have nobody actually follow through with that. I think the same goes for healthcare practitioners, and we spoke about this earlier today, that when we think of doctors, when we think of medical care, it's operating from a place of fear. Because I could be wrong, but in India, I feel like typically that tends to happen from a curative lens, not a preventative lens. So I feel like if more was spoken about preventative care, it would take away some of the fear. It's telling people that, hey, you don't have to be diabetic to walk into my clinic, but walk in and maybe we can reduce your risk, if at all.
So Hello. Yes. Hi. Okay, just a small request. Can you take the video essay so it works in a reel instead of taking it on the landscape? That's my friend, by the way. It just works better for Instagram. So anyway, coming back, I don't like to identify as an influencer. There are multiple reasons why. I'd like to call myself an anti-sugar activist because I feel that I'm not influencing anyone's lives in quitting anything or doing anything. In fact, I'm हिंदी में एक बोलते ना तुम उंगली कर रहे हो किसी को. So I'm the one who does ungli to the brands who sell sugar, and there are a lot of these food farmer and all these folks who've just come up who are just going like, this has palm oil and this has sugar, and I've been saying that for 10 years. Just that I could not name a brand because my father couldn't afford a lawyer probably to fight these bigger corporations. But on a serious note, I think we all come with a certain sense of responsibility. I have some very, very dear friends who are doctors and big influencers with millions of followers. There's Dr. Cutris, Tadaya Vaidya. She speaks about sexual health, something that women in India generally do not speak of publicly, but she went in and out and then she got along with it. There's Manan Vora, who's an orthopedic surgeon, I think. I'm not sure. Don't hate me for it.
Yes, he's an orthopedic surgeon.
But I have a couple of friends who are in the medical field, and they mentioned very clearly that we're not here to prescribe medicine or take appointments. We're here to share educational information. While, of course, everything that is glorified on social media translates to business. But why are we all living then? Everyone wants to make money. They get their... I don't know what's the right word to use these days. Is it patients or clients? It's clients, right?
Patients,
the medicine,
customers,
users
users.
is the right word. So the medical journal came up with this whole thing that you can't call them patients, you call them customers now. So coming to me, I personally feel that I come with a lot of responsibility towards the community at large that I have stuck to. I don't think I can stick along with many causes. Like I don't want to speak on everything, which most of our influencer friends do. Someone talks about mental health, someone talks about bipolar, then someone talks about diabetes, and then glaucoma, and then varicose, all of the above that I have. But that's not the point. I want to stick to my cause and have one battle to fight and educate the right people for the right thing. Which is why I feel doctors can be influencers, but don't come with the intent of business. Business will follow anyway. Like I have a doctor friend, I will definitely not name her, but she keeps crying कि मेरा followers नहीं बढ़ रहा है. And her reason for followers नहीं बढ़ रहा है is patients नहीं बढ़ रहा है clinic में. My give back to her is that everyone who you have as an audience is a consumer. Sometimes don't treat everyone like a creator and well educated. I feel sorry for my language, but dumb it down a little bit. Like when I talk about a CGM, I don't go all Abbott and Dexcom about it. I talk about it as a small sticker patch that's attached to your hand. I don't try to cry on camera when it's pricking into me. But that's something I personally do and I contest for, and I feel a lot of us sort of do so. Also, show what you practice. Like, I show the real stuff that I do on a regular basis on my social media versus being preachy and going all the way backward. Second is that, last bit is that if you're going through a health disorder, I feel it's imperative for you to voice it to the audience, to the world. There are two major celebrities, and I wish and I pray to God one day they come out and speak of diabetes that they live with. Because when they do, they'll create a massive movement like Nick Jonas. He runs the biggest diabetes NGO of the world. So I feel a lot of our stars who secretly buy chocolates from me and talk to me and they tell me, please don't mention in public and media that we buy from you. It's sad because if they spoke, parents of diabetic kids would be so much happier to have diabetic kids.
You know, sometime back, I was talking to a doctor. Sometime back, I was talking to a doctor, and we were talking about social media, and I was insisting that, you must start getting onto social media, you start sharing your knowledge with other people. And the question was, why do I do that? And as we were talking, the one thing that came up was that your knowledge that you have, the skills that you have, and that doctor you would upgrade and upskill themselves regularly, that knowledge will be restricted to only those who walk into the door of that clinic. So it was a duty for the person to share that knowledge with a larger set of people. Now, some of the successful doctors do not have the time to do so, or they have an inhibition about they can't be seen on social media. Ashish, I want to come to you and ask you that how would you go and ask Dr. Devi Shetty to come on to social media and share his knowledge with the world?
So I've already asked him and made him say yes. So that's under process. Yes, we're going to launch his handles very, very soon. But he's already very vocal. So we utilize our own brand handles. And we are fabulous reach both ways, even on Facebook, on YouTube. And we are utilizing that. And thankfully, media is also very receptive in terms of hearing him out as well. So from that point of view, his voice is reaching out where it should. But yes, it will get much more amplified if he has a handle of his own. And it is tough.
Would that be considered as a marketing activity or a social activity to share knowledge?
That depends how we use it. And if we're going to use it for information, how we all have been talking about, if we use it for education, if we use it for right information for that right particular set of audience, I think then we are wrong. And that's what our intention is also. And we're not going to utilize it for anything we call as marketing.
Right. And, Sanjana, are you here? Before I get on to my last question for the panel, can we request Dr. Batra to come in? Yeah. My last question to the panel is, we're talking of health tech. Social media itself is an outcome of technology and disruption in the tech space, right? But the bigger challenge that most people face is creating content for social media. Now, a lot of it is being addressed by AI, chat GPT, etc. How do you think that healthcare practitioners would be able to impact what they are doing on social media using these technologies? And whoever wants to go first.
Can you take this one? I feel I do it a lot, and I'll come out clean for that. I use ChatGPT to write LinkedIn posts, and I feel it's a great space to be in. Of course, I curate what I write because AI with the right prompts comes out with the right answers. Otherwise, if you ask for an umbrella, they might give you a goose. But if doctors, they don't need to do knowledge sharing using AI, but maybe topics can be derived from. Suppose I'm brain fogged and I'm like, I don't know what to write. I don't know what to do. So maybe a typical 2-week social media strategy or topics that I should speak about as an orthodontist. So dental health care, cleanliness, hygiene, going for cleanups, etc., etc., etc. So doctors can maybe pick out those pointers and post about it, write about it, create stuff out of it. And off late, just a little heads up to our younger audience in the audience. ChatGPT has recently collaborated with Canva. So now you can literally create posts by just giving a prompt. So you give them the right prompt, you get the right post. You don't have time to post it. You don't have the time to create it. Just go and stick it on the internet and your audience knows what you want to put out. So maybe that.
Kripa, what would be your take? Because, does ChatGPT or products like these take away the authenticity, which is the underlying emotion which brings the correctness in healthcare?
I definitely agree with Harsh on the fact that actually, I think anyone who's ever created content has probably hit a content block at some point in their life. And has just gone 2 weeks with saying, what the hell do I post? Yeah, I don't know what to post. So I think in terms of just generating new ideas, you can feed in the kind of content you do ask ChatGPT to analyze your content and come up with ideas to help with that block. And I think even Canva, again, in terms of cost-effective marketing for a lot of new healthcare practitioners, they don't need to hire a graphic designer to do so. You combine ChatGPT and Canva and you've got stellar content right there. But even if, I'd say someone is using ChatGPT to write their content, just probably adding your own spin to it would just be helpful.
Ashish, do you think something which is as serious as healthcare content, which would typically come in from a doctor as in whether it is busting myths, etc. Would you encourage the doctors in a hospital to start using ChatGPT to create their content, or would you tell them that please do not use ChatGPT at all?
So I can say that we've brought our doctors to a level where they're doing surgeries Facebook Live.
Wow.
Which is helping students or who are doing their PGs in different colleges to see how it is done and get the experience firsthand. So I think that's a great work that the community, the doctor fraternity is doing in terms of making the impact through the platform that they have in front. I think from a doctor's content point of view, I will still refrain from it. But if as a consumer, I want to not search something and then end up having cancer on it, I think it's a good place to start with. Because I might have certain direct questions and I can ask those direct questions and get those direct answers.
Absolutely. Thank you so much. And the reason I had requested for Dr. Batra to be in the room is because I wanted him to felicitate this panel. And the reason is that, I don't know if most of you know that Dr. Batra, other than being the chairman of Businessworld and the editor-in-chief here, also runs, and he was a founder of Exchange for Media. So, I mean, I don't think there could be someone better to felicitate this panel from somebody who is a media mogul, as I see him, and respected by the media industry. So, Dr. Batra, may I have you on the stage to come and felicitate the...
The cheers generally can't stop, please. Louder, ladies and gentlemen. This is indeed one of the most priceless moments of the day. Just one part of the proceedings. Ladies and gentlemen, it's my privilege to welcome you right now to the pinnacle of the BW Festival of Health Tech, the prestigious annual BW Healthcare 30 Under 30 Award Ceremony. We're all set to begin right now. This evening, we gather here to honor and recognize the outstanding individuals and organizations that have made exceptional contributions to the field of healthcare. Today, we celebrate innovation, compassion, and excellence like never before. The awards not only acknowledge exceptional accomplishments, but also serve as an inspiration to push the boundaries beyond regular limits of what is possible in the healthcare industry. Today's award ceremony is being streamed live across all BW Businessworld platforms, including our social media channels and on www.bwhealthcareworld.com. Join the celebration for today's evening by using the hashtag Healthcare 30 Under 30, ladies and gentlemen. With that, I would like to extend our sincere gratitude to our esteemed partners for their unwavering support. Associate partners Alive Core, Tata MD, Lupin Digital Health. Support partner Life Science, Event Partners, Joy Travels Private Limited, Fandrum, Beanley Coffee, JustBath.ai, The Thick Shake Factory, Reality Plus, Exchange for Media, IWM Buzz, Impact, and Pitch. Now, before we proceed with today's celebration, can I please request the team to kindly play the Partners AV, please? Can we have the Partners AV, please? All right, so before we begin with the evening celebration, we have a very special initiative today. We request everyone to join us in the unveiling of a very special project that we have been working on for quite a long time. It is The Heart of the Matter, a special coffee table book which covers the journey of the impact makers in cardiology. Today, on the occasion of celebrating the Festival of Health Tech, we're unveiling this very special book. Can we please clap for that, ladies and gentlemen? May I please request the team to kindly play the unveiling AV of the coffee table book, please. Once we get the stage set, I'm calling all the respective dignitaries on stage. We're all set to have the coffee table book on. And in the console, if you can kindly play the unveiling AV of the coffee table book, please. So I think we're all set. It's my absolute pleasure and privilege to call our respected dignitaries for the launch. May I please call upon stage Dr. Anurag Batra, Chairman and Editor-in-Chief, BW Businessworld and Founder, Exchange for Media. Mr. Harbindan Narula, CEO, BW Healthcare World and BW Wellbeing World. Mr. Siddharth Srinivasan, CEO, Lupin Digital Health. Mr. Siddharth, do we have him over here in the room? Sanjana, please check for Mr. Siddharth. Mr. Vishal Gondal, founder and CEO, Goki. Mr. Lokesh Prasad, MD, Alive Corp. Hi, sir. Mr. Srinivas Kannan, Director, Aster Health Academy. Mr. Sunil Khurana as well, ladies and gentlemen. Can we please have him on stage? Hi, sir. And Mr. Rahul Adakmol, COO, International Business, BSB. And if I can have the privilege of calling Dr. Velumani as well for this very momentary occasion. So are we all ready? So time for the moment when we actually unveil the special coffee table book, ladies and gentlemen. Come on, claps. Can we have the books, please? Time for the unveiling moment. Loudest cheers as the evening progresses. Let's have all the photos going in. We need to frame them in the right way possible. Lovely frame. Wonderful frame of lovely legends indeed. I'll request all of you to kindly stay back on stage. This is not just the only unveiling of the moment. We have another special unveiling, so I'll request all of you to be on stage, please. Present to you not just the coffee table book, but World magazine as well. So, ladies and gentlemen, can we please clap for the latest issue of BW Healthcare World magazine? And this accounts for nice photos as well. Perfect frame. They need more photos, I believe. Not done, na? Your go ahead matters the most, sir. Yeah. All right. I'll request Dr. Batra to please kindly remain on stage. Moving to the award ceremony, we would like to express our heartfelt gratitude to our jury members who meticulously evaluated numerous nominations. The winners emerging from a pool of contenders truly embody the essence of healthcare excellence. May I request the team.
It was a pleasure being a jury at the 30 Under 30 Awards conducted by Businessworld. I have earlier too been a jury at the 40 Under 40 Awards and have noticed that BW has a very stringent selection process. They come out with the best talent in the fields. My dear winners, all of you are visionaries and the confidence level was too good. My advice to all of you would be believe in yourself, stay focused to your goal, stay committed, and never give up. Don't focus on business, it will come any which way. I wish you all best of luck and a very bright future.
Being on the jury of BW Healthcare World Festival of Health Tech was an amazing experience. The breadth of ideas, the effort and ingenuity of implementation, and the potential impact that these ideas will create were truly remarkable. Congratulations to all the winners and good luck for the future.
I think it's very fascinating to kind of hear the stories of each of the participants, each of the the contenders. I'm just imagining if I just extrapolate it in other fields, look at the kind of availability of talent in our country, and truly, as I say, we are not only young country, but we are really young and the future. I'm really thinking is absolutely bright for us. So thank you again for kind of inviting me part of this jury panel, and I really enjoyed this process.
It was a wonderful experience for me when I was listening all my participants 30 under 30, and it's really amazing to see that young generation is doing wonderful job, very new concept, especially if you see that now students want to help other students. Dietitians want to become nutritionists, and they want to help everyone who are suffering from some disease or who want to make their life healthy and fitness, everything. So they are covering everything, and I was amazed that how these young boys and girls are getting such a new ideas, innovations they are doing.
Express my gratitude to the awesome jury members who were there with me for this jury being at their level, the kind of responsibilities they have for themselves and their businesses, taking out time to listen to each and every nominee means a lot. So thank you everyone for making this a really meaningful exercise. It was really enjoyable. It was very enlightening. Thank you.
क्या बात है 40 अंडर 40 हो या 30 अंडर 30 आई थिंक BW बिजनेस वर्ल्ड है तो सब सही है जस्ट लाउड राउंड ऑफ चीयर्स फॉर डॉक्टर बत्रा एंड BW बिजनेस वर्ल्ड प्लीज We have the magazine ready as well. The stage is over to you, sir.
Thank you. Please give Shubhajit a big round of applause. He's been at it since the morning. That's Shubhajit Ghosh. And thank you, Shubhajit, for hosting us. It's my honor and privilege to be here. I'm a little nostalgic, and Dr. Velu Mani is here. When the first issue of BW Healthcare World was launched, he was on the cover of the first issue of BW Healthcare World. I just saw the cover of the BW Healthcare World. When we launched the first healthcare conference, 7 or 8, I can't be sure, 7 or 8 years back, in the main BW, Dr. Devi Shetty was our keynote speaker. I know it was at the Hyatt Regency in Delhi. So, it feels good. Thank you, Dr. Velumani, for being a friend, for cracking all the jokes that you do, and being a role model for a lot of people in terms of how to exit at the right time. You should be speaking and enthralling everyone. I normally say I don't make PowerPoint presentations. I made one in the morning, and I'm going to make one now. And normally I don't make because I keep saying, do you know why I don't make PowerPoint presentations? You don't know? So shall I tell you? The PowerPoint presentations are made by people who are neither powerful nor have a point of view. I'm Dr. Velu Mani's friend, Harvinder Narula's friend. Clearly, I have both a point of view, and by the fact that I know these powerful people, I think I have a certain influence. I don't like the word power. I'd rather use the word influence. But I'll make we take what we do very seriously. How many of you knew me before you were informed that you won the BW Healthcare 30 Under 30 award? I mean, I don't know you personally. I know you. because of the reasons I told you. And beyond that also I track you. But we've never met, we've never spoken, we don't know each other. I met you at the event, not after that or before that, right? We do our awards honestly. We do it through a jury process. Dr. Velumani, you are again the chair of the first healthcare awards. We have no brief to our juries who to keep in, who to keep out. Yes, the shortlisting process is done by the editor and the CEO and the business head. So if we have, say, 300 entries, we only want to show 60 to the jury, then that filtering is done by the editorial team, and I think we know how to do that. We've done it. And I want to tell you, we used to do these, we still do the Young Entrepreneur Year of the Year award. 20 years back, Deep Kalra was our Young Entrepreneur of the Year award winner, 20 or 18, I can't be sure. Sanjeev Bikhchandani was a winner 17, 18 years back. Aman Gupta's first award 4 years back was a Businessworld award every time he meets me. So I'm sure you all will do well. I prepared a presentation for you, and you guys are very knowledgeable. Do you know who he is? Don't Google. He looks like you, right, Shantanu? A bit. You have more hair than him, right? So do you know who he is? I talked about one thing in the morning, and that is kindness. And I try to be kind in my own way. I have people who work with me know that I have certain pet peeves. I am a perfectionist. I like to do. I was very irritated, Prashant, both in the morning and now, that the things were in the middle and the video was not playing. I am like that, right? But I try to be kind in my own way. In every, whether person I know, not know, whether I'm going to meet. I think he's one of the most kindest people. I've not met him, but I'd like to get him to India someday and meet him. He's a young Israeli climber. He was climbing the Mount Everest a couple of weeks back. He was one level below, whatever the base camp before the Mount Everest. He was somewhere in between. And one of his colleagues, friends, died, and everyone was climbing because if they stopped, the frostbite would go up, they could fall down, and because there is only that much navigation room, you got to keep moving. So he had the opportunity of becoming Israeli to climb the Mount Everest. What did he do? His name is an Israeli name, so his name is Nadam Ben Yehuda. I've been lucky enough, I have a very close Israeli friend. I've been to Tel Aviv once, and it's a lovely country. I've been to Israel and, of course, Tel Aviv. So his name is Nadab Ben Yehuda. And he saved his friend. He brought him back, and, on a mountain, bringing somebody who's almost, it's heavy. So he and another friend decided to bring them back, and the person they brought is alive. I think these are real heroes. I would want each one of you to be like him. I don't know him, but hopefully I'll try to bring him to India and get you to meet him. His name is Nadab Ben Yehuda. That's me. You know which one is me, right? You know who's the other guy? You watch Hollywood movies? Who's he? Yeah, JVCD. So I want to tell you, I was thinking what I'd say to people who 30 under 30, and we take what we do very seriously. So I started Exchange for Media when I was 28. So I was less than 30. And in my case, it is about serendipity. I didn't want to be an entrepreneur. I come from a middle class family. My parents are academicians. And then I went to Monaco. I went to Cannes, the advertising festival. And from there, I was 31, above 30. And I was sitting in Café de Paris in Monaco, in Monte Carlo. And I saw him, and I said, I am a quizzer. I have a quizzer's memory. And I said, he looks familiar, but I had a very late night in Cannes, so I was not able to recollect. But I said, I know him. Of course, not know him. And then there was a friend of mine who knew his producer, Vijay Amritraj, and who knows everybody in Hollywood. Bhuvan, Harbinder, Bhuvan Lal was there. Bhuvan and me were there. Bhuvan said, he went up to him, and Bhuvan has a very rich baritone. And he used to run the Indian Broadcasting Federation, which is a nodal body. And I had just started Exchange for Media. I didn't have much to do. And so I used to land up and say, "Koi khabar de do." So he one day said, come with me to Cannes. So I went with him to Cannes, and I used to wear a tie and suit in those days, I was younger, I was 31. So I met JC Jean-Wang Cladam, right? That's what he called. And I had watched his Double Impact, and then Bhuvan told him that he knows Vijay Amritraj, and then we started talking. So I did a lot before I turned 30, and I did a little more things after I turned 30. This is after I was trying to desperately look for a picture. I went to a business school called MDIM from the first batch. In the second year, there's a picture of me smoking a cigar, and I showed to my children that I wasn't born bald, or I used to be thin, and I couldn't find that. So I just want to, one of the best things about doing what we do is collaboration, meeting people, and at the end of the day, human life's about connections. It's about impacting other people in a positive way. Of course, looking after them. And I believe in the process of reverse mentoring. I shouldn't be telling you what to do. You guys should be telling me, Dr. Velumani. Dr. Velumani can be a philosopher now. Because you know why? Once you make a lot of money, anything you say, people buy it. Right? In your case, you said a lot of good things even before that, sir. But this is what a very famed investor said. And then the best part of my job is I meet a lot of people like you, and and we do it in auto, we do it in 27 industries, in main BW in E4M, which I don't run anymore, but it is like I keep telling. One day I was at a party early this year, and my wife was with me, and I said I have 4 children. So my wife was looking at me, but I only know 2. So I said Exchange for Media and Business World. So I don't run, but in the advertising, marketing, martech, media tech space, also I meet people who are doing amazing Cs. Now I said, what would I say to young people who are I met some of you, 3, 4 of you since the morning. You're so accomplished. I could learn so much from you. But still, reinforcement matters because we're too busy doing. I still buy more books than anyone I know. I read a lot of them, not all. These are much more than I did in the last 3, 4 years. I would say avoid the 3 C's. I like these, 3 C's. I talked about the 3 P's in the morning. I have 2 P's in my life, my prarthana and my prasanna, But these are 3 C's. Can you guess what are these 3 C's? It's not caffeine, though I invested in a coffee company, but no, it's too hi-fi, right? It's very simple, and I really believe in it. One is comparison. I know awards are about comparison, so there is a little irony in what I'm saying. But I believe all the winners, I've seen your profiles, I know your names, I've seen your entries. After who's won, I've seen the list. I can tell you it's an amazing list, and I can compare it with any good list that we've done. We've identified lots of winners. And we were lucky. It's not, we just have a process. So comparison. I genuinely believe I meet young people. I just did salary reviews. I did a little late in the year for various reasons. People compare in the company, and it's okay. A little bit comparison is okay, Mr. Kurana. A little bit comparison is okay. But, comparison is the thief of joy. I heard this very early in my life from my dad. And I'm very happy. There are friends of mine who ask me, how much money do you have in the bank account? I said, I'm happy. I just want to be more healthy. And I want to be more contented. So comparison, don't compare your journey. Somebody's raised 80 million. I mean, inspiration is okay. So don't compare. Young people compare. Old people also compare. You're not old. I'm talking of young, Dr. Velumani. Complaining. There are some colleagues of mine I won't take, but Arvinder will. Senior colleagues who, if they ordered from Swiggy gets 10 minutes late, they threaten the guy, we are from a media company, we will do this, that to you. I mean, and they've been working with me. And what is this? So this is a mild form of complaining. You complain about so many things. If you complain, whatever you complain about, you attract. That's true. Whatever you focus on grows. It's not bullshit. I would never bullshit you guys. You know why, Shantanu? I had my first boss in life was an Australian. He told me once, he's died last year in COVID. God bless his soul. He said in his Australian accent, I can't say it like that, but he said, never bullshit a bigger bullshitter. And Dr. Velmanu, I'm not talking about you again here. I must clarify that. And criticizing. Sometimes people don't know enough about. These days, I meet people Vishal is not in the room. He and me have a common friend who's a large investor. And he met me 6-8 weeks back. And he told me things about C. I said, really? I said, who told you? So I would like to meet him because these are not true. Luckily, he is a very close friend of mine. And later on, he discovered whatever I said was gospel. So criticizing people without even knowing them. It's a waste of energy. It's a waste of blessings. These are my favorite, and I try and follow. See, we are all humans. We may not get to zero, and they keep saying it's not about perfection; it's about progress. If you can bring down, and these are things that I follow. A lot of my colleagues are Priyanshi there. She's worked 2 years. Arvinder is a friend of mine who's worked now 2 years with me. Sanjana's worked. Mr. Rajaraman's second stint. I follow these. Hope. And I bought a company that was loss making, a Businessworld, and I built Exchange for Media from grounds up. It has been profitable for the last 19 years, never raised capital, never felt a need. I thought in 6 months I'll make Businessworld profitable, and I raised a lot of money 9+ years back. But it took me 6.5 years to make it profitable, and almost $10 more million of investment than I already envisaged. I've told my story to Dr. Velumani privately. But 2.5 years we became profitable and we are growing. I don't want to talk about the numbers, but every day I hoped that we do well. And I wake up every day in the morning believing that today will be better than yesterday, and I give it my best. So hope is the biggest energy that you can get. If you believe you can do something, you'll do it. And you know it, you guys are here. Now, the second H, whichever H you like, you can choose. I'm in Bangalore, so whichever H you choose like, you can take it. Hustle or hard work, it's the same thing to me. Anyone who works with me knows that I'm at it from 9 a.m. to 9 p.m. and I love what I do, so it's not work for me. It's not work. I'm having fun. Talking to you guys is work. I don't know. So you guys have achieved something, Shantanu, you're very famous, my daughter. I showed you her text, right? And all of you are very accomplished. As you grow in life, as you do well, be more humble. Humility brings more blessings. If you're grounded, you'll get ideas, you'll do better, and you'll have lesser weight on yourself. And I'll run it very fast because I don't want to stand between, I don't want to preach too much. The power of compounding. Your guys are young. My father, who's be 84 on 15 December, saves for my son and my daughter. And he just gave us 2 checks, which are fairly large checks. He put a very small amount of money. My daughter is 19 plus, my son is 15. He'll be 15 on Sunday. He'll start his 16th year. And just the power of compounding. Young people don't save. YOLO. I'm not going to make generalization, but data supports it. And I'm talking of India, I'm not talking of America. In America, they're broke. They have student loans and so on and so forth. Also, this I say to my younger self also. There is a proven research which says your mind's acceptance of age is 10 to 15 years behind your body's aging. So if you start looking, it was a little better quality of food habits, more activity. Luckily, I've always slept 8+ hours in my life. So start taking care of. I know you're right now fit, in the prime of your careers, in the pink of your health, absolutely in every aspect. But do look at your health a little more than. And all this. Don't spend time with people who don't treat you well. Learn how to say no. No is the biggest way to get to where you want to go. You don't have to say yes to everything. Be good to the people you care about. And I want to say, as a parents are also people. Sometimes you get too busy with your friends, too busy with whatever you're doing, and that's okay. Parents like children being happy and doing whatever they like. But be good to people, whoever you define as family, friends. Show up for them. Your presence matters. I went to my son's tennis match 4 weeks back. I'd never gone before that. In the night just before he slept, he told me, "Thank you, Papa, for coming to the tennis match." He won that day. And, I thought I should have gone earlier to my son's tennis match. Why I've gone so late in life? But it's never too late. Don't be afraid of taking risks. I'm not talking of marriage, huh? This is not a slide on marriage, but it is about building companies and whatever your dreams are, go pursue them. If you fail, you'll have learnings. If you succeed, of course, you'll feel well. And there is a song, I sent a list of books to Tanvi and Shweta, who support me on my PPTs. I send them ideas, write things, and then WhatsApp them and then put it in a PPT. And they said, but that's a song by Alicia Keys. I said, it's a book. There's a song that I heard many years back. How many of you know this band called UB40? Why is it called UB40, Shantanu? Yeah, I know. That's the song that's most famous. Why is it called UB40? Does anybody know? Don't Google. Yeah. So it's the dole form in UK. They're a British band. The dole form, the unemployment benefits. When you fill that, you get money. It's called UB40, unemployment benefits 40. So I knew that's the most popular song. Then there's another song called Can't Help Falling in Love from the motion picture Sliver. Sharon Stone in it. So difficult to forget. But I am a books, movie, song buff. Don't watch enough movies anymore, but I used to. These two songs are popular, but there is a third song called Higher Ground, which is a little less popular. And I won't sing it. I don't want all of you to run away. By the way, I sing at parties where you invite 100 people and 200 show up. I come and sing, and you're back to 100 again. So if you need me, but I won't sing. But the lyrics of the song go, it's called Higher Ground. Every day, every hour, I'm finding more, I'm learning more. The more I know, the less I know. The less I know, the more I dig from the higher ground. So we know very little. We don't even know what we don't know. We know very little. So there is so much to grow. I meet young people who are so sure, which is okay. You have to be sure about something. And again, I didn't know. I worked for 4 years. After MD, I joined a real estate services company. Then I joined IT services company. And then finally joined J. Walter Thompson, where the idea of setting up Exchange for Media came. And Exchange for Media, we didn't want to do a media company. We were setting up a B2B e-commerce platform for buying and selling of time and space. So I will run a presentation. I'll put it on LinkedIn. Invest in your family. It's worth it. Young people are too busy, focused externally. Be kind to yourself, respect yourself. That includes sleeping. I talk about sleep in the morning. I find my daughter sleeps at 4 a.m., 5 a.m. And she studies in the US, so there is when she's there, she's doing, but generally they sleep late. There are people who text me in the night, I'm fast asleep, I see it in the morning, right? I am a book buff. I believe you are what you read. So I can recommend 300 books. And again, I thought of this at 3 p.m., so I put this together very fast. But have you read Shantanu Naidu's book, I Came Upon a Lighthouse, a short memoir of life with Ratan Tata? How many of you read it? How many of you read it? How many of you not read it? All of you. Please buy his book. Shantanu, you're here. Please, we'll send a link of Amazon buy. You should also, have you read of the book called Getting the Bread, The Gen Z Way to Success? That's the book in blue, published by Home Books, published by a young girl called Pratna Batra, who happens to share her birthday with me and is my daughter. So, of course, I'll put Pratna's book. But let's go on to people I don't know well. As I said, I thought of this at 3 p.m. and I wrote down, and I didn't do a very scientific job. Last year on 18th Feb, I read this book on health and health tech called Dr. Velumanu, I gave it to you. Life Force by Anthony Robbins. If I followed it, I'd live till 150 years. Humankind, I talk about in the morning. I talk about Utopia for Realists. A book that I read about 15 years back, which is still my favorite book. It's a very short book. It's called Tuesdays with Maury by Mitch Albom. It basically says spend time with your loved ones. Apne maa baap, biwi, bache, grandparents, friends, whoever you love. Because in office, in enterprises, a friend of mine died. He used to run a very big startup. His co-founder has taken over. I don't want to pepper fry. Amrish has gone to heaven. Life chalti rehti hai. So look, spend time, work hard. I recently read this book called Almanac of Naval Ravikant. It's free digitally, but it's in print form. Some of you may have got it as gifts who are speakers. When it is on every bestseller list, so I said, let me buy it. And it's a good book. I must say I wasn't disappointed because and it talks about Vedas a lot. It talks about, I mean, I do a lot of things consciously and subconsciously, except the cold baths. Then there's a book called The Power of Silence by, that should have been N, but he passed away last year. Then there is a book called The Sixth Extinction by Elizabeth Colbert. It's one of my favorite books. These are some books that I read, but in our list, we have almost 50-50 this year on the 30 under 30. Almost 15 women. Almost. Harbinder, there are 14 or 13. 14. 14 women. So we are out of the list of 30, we have 14 women and 16 men. Which is good. There are some lists, like in our legal list, we have more women, which is good. It's representative of what's. There's a book that I read maybe 10 years, 8, 9 years. It's called The Gifts of Imperfection by Dr. Brené Brown. It's about shame. It's about, guilt. Then Tim Ferriss is the only podcast I listen to. I don't listen to anything else. I read his 2 books called Tool of Titans and Tribe of Mentors a couple of years back. And these are some books. I can keep. Another thing, a lot of you are entrepreneurs and you started in your journey and you reached milestones. Some of you are doing it frugally, build unit economics. Like, my daughter was explaining to me about Shantanu. It is profitable. He's not scaled up. Then Arvinder was explaining me the same thing about you, right? There are many books. I can give you books and books. These are books I bought and read. Some are less better than the others, but so read books, whichever. There are enough ways to find out which books you can recommend. We only give books. I used to get red wine at one point in time on birthdays, but I've replaced it with books. I want to see this. There were no 30 under 30s when I was around that age. So if we can play this video. How many of you watch Friends or watch this video from Friends? Than you've accomplished till today. We wish you luck in your journeys. We follow your journey. We try to be a catalyst. And I hope we, people like me, can learn a lot from you through reverse mentoring. I wish you luck. God bless you. Thank you. I don't want to stand between you and the awards, but I hope it is something that maybe there's one idea that you like and it can help you. That's how I put an effort into doing this. I did recommend some books in the morning. Some of you were in the. I put them in the list again. I wish you luck. Stay kind. Stay focused. Life is about trade-offs. Whatever you focus on will grow. A lot of people ask me, "Oh, you're very busy." So I said, "I'm busy because I make time for people." You should always meet busy people. They're busy because they make time for initiatives and people. So I wish you luck. Look forward to celebrating your success. Your family is a very important part of your success. You may feel happy, but your parents, brother, sister, whoever loves you feel equally happy or more happy than you. So share your good time with them. Some of you may have brought your parents or your family members here. I congratulate all the family members and those who are listening to this broadcast on BW Healthcare World. I want to say that the process of awards is like playing cricket.
Thank you, Darpan sir. Yeah, please.
Thank you. I know there's a long line of achievers waiting, but I think that Sir already said everything there is to say. I think we're young people trying to work towards something. Hopefully, there will be lots of milestones along the way. Somebody got lucky on a given day, but thank you so much. I actually wouldn't have endorsement is there. So Erasavir actually was founded during the pandemic because we thought there aren't enough solutions that scientifically try and attack viruses like SARS-CoV-2. While developing it, we found there are lots of viruses like the flu, which have similar structures and basically get people sick every year. So we created nasal and mouth sprays that can hopefully either help you avoid falling sick, or if you do fall sick, they can reduce the time it takes for you to be up and running again. So do check us out. And it's sniffle season. I hear a lot of coughs.
All right, congratulations, Darpan sir, once again. Yeah. So, can I please call upon stage Mr. Siddharth Srinivasan, the honorable president. So the next awardee is Siva Teja Kakileti, Director, Principal Research Scientist, Founding Team Member, Niramai Health Analytics. Dr. Anurag Batra, Mr. Siddharth Srinivasan, Mr. Sunil Khurana, and Mr. Harvinder Narula will be giving away the award. Congratulations. For recognizing the to be an achiever. So I really appreciate the efforts that BW Healthcare is doing, and I represent Niramai. So Niramai is a startup where we have developed a solution which is affordable, scalable, and radiation-free breast cancer screening test. This is completely Indian-made, and we have been in 6+ countries, and 120,000 women have already taken the test. So yeah, thank you for the recognition. Congratulations once again, sir. Can we have the next AV of the next winner, please? Welcome once again and congratulations. Please have your work.
It's a privilege to be here. I genuinely feel that there's many more people out there who are working much harder than anyone of us. We just happen to be privileged enough to deserve the spotlight. So I think when we find and discover someone who deserves to be on the list, it is our duty as the 30 under 30 to uplift them. And as for Goodfellows, the only punchline I have is we give grandkids on demand. Don't fight it. Don't be afraid of it. If you know any senior citizen in Bombay and Pune who needs a companion, please reach out to us and I'll help them out the best way I can. Thank you.
Thank you. Congratulations once again. Can we have the AV for the next winner after the photo is done? Loud cheers, please, once. Diabetic chief, conscious mithai wala. Dr. Anurag Batra.
It's so funny how I had thought of what I will say and I forgot everything. So I feel that these awards mean a lot to me, and especially because it's healthcare, I'll take more than 30 seconds. 13 years ago, I was diagnosed with diabetes, and my doctor said, "You can't do it." My parents said, "You should not study this." My teacher said, "You can't pursue XYZ." And today, this trophy and this lovely certificate is a representation of all the diabetic kids who are told, "You can't do it. You can, and you can be the best at it." Like Shantanu said, of course, a lot more people are deserving. But I feel since we have the media amplification, why not? Also, I'm hungry, so I'm going to quickly leave. Thank you so much.
Thank you and congratulations once again. We'll play the AV once the photo is done. Can we have the AV for the next winner, please? Rishabh Gupta, Vice President, Sharda Hospital. On his behalf, we'll have Mr. Rohit Gupta on stage to collect his award. Now, cheers, ladies and gentlemen. These are really special awards earned after a lot of hard work, determination, and dedication. Congratulations, sir. And in the meanwhile, can we have the next AV of the next winner, please? Can I please invite Dr. Subhash Chandra, Director, CEO, SR Multi-Speciality Hospital on stage, please. Congratulations, sir.
So I would like to express my gratitude to BW Healthcare World and the jury for selecting me. And our mission is mainly to provide the best of healthcare services in Tier 2, Tier 3 cities. We are mainly focusing on women and childcare. We have 2 branches in Ballari, Karnataka. We have infertility with high-risk pregnancies along with neonatal care. So this award I would like to dedicate to all my staff and the family of SR Hospital. And one thing I would like to say is there are very few doctors who are in the administrative field, and we would like to see more of the doctors in the administrative field because they understand the ground reality of what is happening in the rural and in the healthcare sector. So that's it. Thank you so much.
Congratulations, sir. And the next winner for BWHealthcareWorld.com Festival of Health Tech 2023 30 Under 30 Award goes to Roshan M. Consultant, Interventional Pain, Ear Mediterranean Hospital, Mysore. Loud cheers. Congratulations, doctor.
Hi everyone. Thanks for having me here. It's a great privilege. So I completed my MD anesthesia from Ramanalohi Hospital, New Delhi. Some of you might be knowing. So after that, I happened to meet 2 of my great mentors, Dr. Swati Bhatt from Bangalore and Dr. Pankaj Surange sir from Delhi. So those, they told me what's about pain medicine. Why it is so important nowadays. So it's like minimally invasive surgery, same like interventional cardiology. You don't have to open the heart to treat the disease. You don't have to open the spine to treat the fracture. We do vertebroplasty, just like putting a cement in the vertebrae, that is the bone. So with this, patient will come out of the procedure on the same day without the prolonged bed rest what we used to have after the this one spine surgery. So it's very minimally invasive and less rehabilitation is required, and they will get back to work very soon. So not only vertebroplasty, same like this, many other procedures can be done only on the day care basis. So patient will be having little bit of, they won't be having any nick on the body. So this is not a new branch, outside in the foreign. At least in India, at least in past 20 to 25 years, it's booming. So I have achieved all this in last 11.5 years with MBBS, MD, and the 2 fellowships. So if I can do, anyone with interest can do in less than 11 years or 10 years. So thank you.
Fantastic and inspiring indeed. Congratulations once again. And the BW Healthcare 30 Under 30 award goes to, and we have the next promo, please. Senior Investment Specialist, Invest Media. Can I please request him to come on stage, please? Congratulations. Loud cheers, ladies and gentlemen. Loud cheers, ladies and gentlemen, requesting you.
Thank you so much, everyone. I'm honored to be part of the BW 30 Under 30 community. I won't take a lot of time because a lot of awardees are still pending. But I'd like to reiterate what Mr. Vilumalai said earlier. For us as a country to kind of leapfrog into a digital health ecosystem or to get at par with the global healthcare system, we need to focus on innovation and collaboration. I think these are the two key things. As part of Invest India, it's the National Investment Promotion Agency for the Government of India. I work under the Make in India team for bringing investments in medical devices. And I see a lot of companies coming into India right now to basically capitalize on the tech talent that we have here. And I think our companies, the local companies, should not only focus on the local market right now.
Solid Health. Can we please have you on stage? Congratulations. Loud cheers, ladies and gentlemen. A lot of hard work goes into all this. She's the first woman to win this, so I think she deserves the loudest applause, ladies and gentlemen. Come on, please, show your best.
Thank you so much, first of all, to the incredible jury and BW Healthcare World for this incredible recognition. I'm really honored to be on the list, so thank you so much.
Friends. And the next BW Healthcare 30 Under 30 award goes to Shubham Gupta from the Connecticut. Talia, ladies and gentlemen. Congratulations. Claps can be a little louder, please, if I may request. Thank you.
much for this honor. Actually, 11 years ago, I left my dream job in Japan to come back to India and start building an Indian healthcare ecosystem. Some of the people I met were highly skeptical of what I was trying to do. They termed as career suicide. But I'm really glad that I did that. I spent 8 years now in healthcare, and awards like these keep me going. I want to thank my family and friends for supporting me during this journey. Thank you very much.
Congratulations, sir. The moment is yours. Please enjoy. And the next BW Healthcare World.com 30 under 30 award goes to Saloni Jain, Deputy Manager Marketing, Narayana Health. Loud cheers. Another woman in the list. Let's clap. Congratulations, ma'am. Loud cheers, please, ladies and gentlemen. Congratulations.
I'm actually not prepared for this. First of all, I would like to thank BW Jury for this great thing that they have done to me. And second thing is, sorry, I'm just too overwhelmed. At Narayana, actually, I learned a lot about healthcare and the importance of health at Narayana itself. And I would like to quote something that our CMO said today, that healthcare is all about, when people talk about healthcare, they always think that it's something that we have to have a fear of. I want to dedicate my work to healthcare to remove that fear from healthcare altogether. Thank you.
Once again, the moment is yours. And the next BW Healthcare World.com 30 under 30 award goes to the next winner is Chahat Vasal, co-founder, Nerd Needy. Congratulations and loud cheers. Loud cheers, please, ladies and gentlemen. Another woman making us all proud.
Thank you, BW, for this incredible award. And I must say, I'm not from a mainstream healthcare field, but the entire event was very insightful. So a little bit about my company. It's called Nerd Nerdy. We work in the field of special needs. We create tech products as well as physical products that help stakeholders in screening and the diagnosing journey of children with special needs from ages 2 to 16. So our made in India that can screen for over screening tool. And with the growing population of children with especially neurodevelopmental disabilities, which are usually hidden, like autism, dyslexia, and WHO predicting 12.5%, which is 1 in 8. Just one request, that we all probably know one family who is dealing with this. So just to help remove the stigma and do our bit in integrating them into the mainstream society, whether that be through jobs or just educating ourselves as well. So one request for everybody in that realm, and I would just like to thank everybody again for such an honor and recognition. Thank you.
Wonderful and special indeed. Congratulations. I'll request Siddharth sir and Sunil sir to kindly be seated, and thank you so much for your time and presence on stage for the awards. And I'll request Mr. Kanan Srinivas and Mr. Rahul Adakmol to be on stage as honorable presenters for the next set of awards.
To all the winners, I'd also like to tell you that we're going to have a group picture which goes into the magazine later. So please stay back for a group picture. It's important for us as well as for you, right? So I request all of you to stay back for that picture. Don't miss that opportunity.
That is going to be a lovely picture indeed. So request you all winners to stay back. And do we have our next presenter as well?
It will be an honor for everyone who's in the healthcare to also get Dr. Velmanu to be here and to give the award to Dr. Velmanu. It's value money.
Value money, absolutely. Always adding.
God knew why he named him what he named him.
Welcome, sir. And the next BWHealthcareWorld.com 30 under 30 award goes to Anushka Jolly, co-founder, Inner Arc, BlockTech Private Limited. What an inspiration. Congratulations once again. Loud cheers, ladies and gentlemen, for this lovely moment. She's the youngest winner. She deserves the most amount of appreciation for sure. What an inspiration. I'll hold it for you. You can say. I'll hold it for you. Sure.
Well, firstly, thank you so much for this honor. It's been amazing to not only receive the award, but also have the opportunity to talk to you and have such an insightful discussion. I'd like to dedicate this to my parents who are here and they've always supported me. So thank you so much. And I hope using Kavach 2.0 and Kavach 3.0, I'm able to make an impact in the lives of adolescents. Thank you.
Congratulations, Anushka. May you keep inspiring like how you are. Thank you so much. And the next BWHealthcareWorld.com 30 under 30 award goes to Rajat Jain, founder and CEO, Sunfox Technologies. Welcome, Rajat sir, and congratulations. What a moment. Loud cheers, please, ladies and gentlemen. Congratulations. Okay, and the next BWHealthcareWorld.com 30 under 30 award goes to Shweta Shah Panchal, founder of the Diet Therapy. Come on! Congratulations once again. The cheers need to get a little louder, ladies and gentlemen, if I may request. Thank you so much. Loving the energy, loving the vibe. Congratulations.
A very big thank you to BW Healthcare World, all the jury members, Dr. Narula, Dr. Batra, and Thank you to my family members for always supporting me. I am a clinical dietitian and a nutritionist. Our primary focus is preventive healthcare. So, when I say preventive healthcare, it means diet and nutrition. डाइट से सबको डर लगता है, कल से सब खाना बंद, सबको ऐसा लगता है. So I really want to change that narrative, and I hope I am able to do that. So we are spreading that awareness, and we are creating awareness on the same through our Instagram platform. Yeah, that's about it. A very big congratulations to all the winners. Thank you.
Congratulations once again. This is your moment. Please enjoy. And the next BWHealthcareWorld.com 30 under 30 award goes to Dr. Rahul Kanungo, founder and CEO, Pathlete. Congratulations, Dr. Rahul. What a moment. The cheers, please, ladies and gentlemen, if we can have it a little louder. Loud cheers, please, ladies and gentlemen. Congratulations once again for this lovely honor.
So, thank you. I would like to thank the entire jury of BW Businessworld for giving me this wonderful opportunity for standing over here. And I am the founder of Pathlete. Actually, I'm not just the founder. I have an entire team of co-founders without whom this would not have been possible. So I would like to thank my entire team and my friends and my family, my parents who have supported me through this. So in Pathlete, we are aiming to provide end-to-end diagnostic solutions, setup solutions, and quality control programs, accreditations, etc. And we are also trying to bring a new revolution in the field of digital pathology by collaborating with our various partners, by bringing digital slides into the market. So we have a huge collection of that, and we hope to take it forward, and we hope to bring a real change in the field of diagnostics. That's why the tagline goes, Pathlete, Empowered Diagnostics, Empower India. Thank you all.
Congratulations. Please enjoy the moment. Thank you so much, Rahul sir, for being with us over here. You can take your seat. Thank you so much. And I'll request Mr. Lokesh Prasad to come up on stage and join us as an honorable presenter before we move on to the next award. And the next BWHealthcareWorld.com 30 under 30 award goes to Anmol Arora, founder and CEO, Dogvita. Now, cheers, please, ladies and gentlemen, and congratulations for this lovely moment. What a lovely frame indeed. Loud cheers, please, ladies and gentlemen, as we have the awards going in.
It's fine. First of all, a lot of gratitude and a lot of thank you to the Business World healthcare team and the people who are organizing the event. The execution is very excellent. I've done a lot of events in my life in college, a lot of concerts, and even today, everything is really good, really smooth. Regarding me, I think we've had a very powerful journey from getting funded by Y Combinator to raising more money to building a profitable business now, by the way. So thank you so much for recognition and the efforts. We are a mental health company. We help people find the right support. Our focus is not volumes. We value more quality over quantity. So over the last 18 months, we've helped more than 15,000 people find the right support. We made a lot of difference in their lives in areas of personal growth, relationships, and just in general their work life. So yeah, thank you so much, Business World, for recognizing these efforts, and thank you to everyone for coming here today.
Congratulations, sir. This is just the beginning of many lovely things going forward. Lovely. And the next BWHealthcareWorld.com 30 under 30 award goes to Dr. Astha Saxena, consultant, psycho-oncologist, Metro Cancer Institute, Faridabad. Congratulations, Dr. Astha. Let the claps keep coming, ladies and gentlemen. Thank you.
Good evening, everyone. On the behalf of psycho-oncologist community, I would like to thank you, BW Events, for recognizing the need of psycho-oncologists in India. And I really want to thank my parents and Dr. Suman Gupta, who's the director of Metro Cancer Institute, who gave me this opportunity to have my own department in the institute and to create more awareness about the need of psycho-oncologists. So thank you so much, sir.
Lovely. It's so inspiring to see these lovely, inspiring stories of this woman. They're inspiring in the best way possible. Thank you so much. And can we have the next BWHealthcareWorld.com 30 under 30 award winner, please? Dr. Radhika Raheja, consultant dermatologist and hair transplant surgeon, Metro Heart Institute and Multi-Speciality Group of Hospitals. Congratulations. Let the cheers keep coming. Thank you so much.
Hi everyone, I am a dermatologist and a hair transplant surgeon in Faridabad. So I would really like to thank this BW Events and my husband who's here, and I would really like to thank my family as well. So as a dermatologist, I'm working towards changing the basic set standards of how beautiful you should be and how that relates to your confidence. I want to tell people what is normal and what is not, what should be treated and what should not be treated. And I do hair transplant surgeries and get people married as well. Thank you. Thank you.
I think the last part was the most exciting. Congratulations once again. And the next BWHealthcareWorld.com 30 under 30 award goes to Kripa Jalan, founder Burgers to Bees. May I please have Kripa Jalan on stage, please. Congratulations. It's so heartwarming to see these women one by one coming and receiving these awards, ain't it? Let the men clap a little louder, please. Just for these lovely women out there. They deserve it.
Thank you so much, BW World, for this incredible honor. Around 8 years ago, they told me that I could never make a career out of telling people how and what to eat. Now I'm running a digital deep health clinic that combines practices of eating psychology, behavior change, and advanced nutrition to help people look, move, and feel their best. So thank you.
What a story. Congratulations for not listening to anyone at that point of time. And the next BWHealthcareWorld.com 30 under 30 award goes to Anushya Sri Ramesh, co-founder and chief operating officer, COO, Neurostellar Private Limited. Congratulations, ma'am. Loud cheers, please, ladies and gentlemen. All the women over here, they deserve special appreciation indeed for inspiring so many of them.
So hello everyone. So first of all, thank you so much for such an honor, especially 30 under 30 in the healthcare domain, for giving it to Neurostellar. So at Neurostellar, what we're doing is today's topic of talking a lot about mental health and things. What we're doing is we are into the mental tech space where we are developing neuro wearables for diagnosis and also for detection of a current state of mind of individuals in a real time. So thank you so much, and really looking forward to collaborating and taking this space forward as well with Neurostellar. Thank you.
Congratulations, and may you keep inspiring people like how you are. Wonderful. Another light-hearted moment going on stage. And the next BWHealthcareWorld.com 30 under 30 award goes to Devika Parekh, Group Head Manager, Learning and Development, Care Hospitals. May I please invite her on stage to collect her trophy. Congratulations, ma'am. Loud cheers requesting, ladies and gentlemen.
Very good evening to all of you. I would like to thank BW team for and the jury also for choosing me for this award. I would also like to thank Care Hospitals for nominating me. Special thanks to my CEO Jasdeep Singh for encouraging me to go for this award. And I'm very lucky that and thanks to technology. My parents are also watching this event, so I mean, all the thanks and gratitude to them. So thank you so much.
Congratulations once again. And before the next award, may I please invite on stage Mr. Kuruswamy as an honorable presenter. Sir, welcome. And the next BW Healthcare 30 under 30 award goes to Ishan Kapoor, founder and managing director, Life Express Healthcare Private Limited. Congratulations, Ishan.
Hello, everyone. I would like to thank the jury for recognizing me and my work. So basically, we are an ambulance service provider, and we have launched smart ambulances, which provides real-time patient monitoring system, which helps the doctor sitting anywhere in the hospital who can see the patient in real time. And in this way, we have been saving a lot of patients' lives, especially during the golden hour where a patient needs to be given a CPR, and a doctor has helped the driver in the ambulance on how to give the CPR. Thank you so much. Yeah.
Sir, you're doing a great job. May you continue to do that and inspire people the best way possible. Congratulations once again. And the next BWHealthcareWorld.com 30 under 30 award goes to Mr. Viren Agarwal, Chief Operating Officer, My Digi Records. Can we please have him on stage, please? Congratulations. Now it's time for some really loud cheers after that offer.
I would like to thank BW World and the jury for this prestigious award. And I would like to thank my entire team, my family, my team at My DJ Record in the US and India for putting the faith in me and letting me lead in the forefront and doing the hard work up here. My DJ Record focuses on empowering the patient and reducing healthcare cost for the consumer and giving the best healthcare possible. Thank you.
Congratulations. And the next BWHealthcareWorld.com 30 under 30 award goes to Geeta Dhawan, Marketing Manager, Health Cube India Private Limited. Can we please have her on stage, please? Congratulations, ma'am. Congratulations once again, and all these ladies, they deserve our special appreciation indeed. Loud cheers, please, ladies and gentlemen.
So, hi, good evening, everyone. First, I'll start with my company. I'm representing HealthCube here, and we are basically a medical manufacturing device company. And we've made a device which can do 30 plus tests, and the results are available in a couple of minutes. This device is basically for rural and remote areas of India, and that's how we are contributing and giving back to the society. Then I would like to thank the jury and BW team for giving me this opportunity to come here and represent my company. Thank you so much.
Wonderful. Congratulations. Vimal Govind MK, MD and CEO, Gen Robotics Medical and Mobility Private Limited. Unfortunately, he's not here, so we have Mr. Afzal, his co-founder, to receive the award on his behalf. Can we please have Mr. Afzal? Congratulations. Congratulations.
First of all, thank you, BW, for recognizing health tech startups like us. On behalf of my co-founder and my company, Gen Robotics, receiving this award. And don't mind, we are all working on same vision, and we are all under 30. And coming to Gen Robotics, we are actually started long back in 2016 as a startup, like very passionate on robotics, for making humanity life better, in specifically in area of like people having like very extremities in their daily life. So you may be known for us for developing an innovation called Bandicoot. That was a robotic scavenger that saves life from manholes. So that's we are known for, and we recently spinned off into healthcare, and that is about transforming the healthcare well-being with robotics and AI. And we introduced a robotic gait trainer that is like transforming the PMR department, especially the physical medicine rehabilitation department, for the people who having stroke, spinal cord injury, with most advanced robotic gait trainer. And we recently launched in the market, and we are actually helping tier 2 hospitals to afford this technology to give this to the end user. And almost in the last 6 months, we introduced 4 tier 2 hospitals in India, and we are giving the dream robotic rehabilitation to nearly 80 patients in India. And we believe this can be scaled into every aspect of our health tech, and like every department, PMR department, technology. Yeah, that's it. Thank you so much, and thank you, the kudos to my entire team and all the Gen Robotians. Thank you.
Congratulations, Afzalji. Congratulations, Vimalji. And the next award for BW Healthcare World 30 under 30 goes to Garima Goel, dietitian, Garima Diet Clinic, registered dietitian, diabetes educator, and owner of a reputed clinic. She'll be joining us virtually. So can we please have her virtually over here? Let's connect with Garima Goel.
Do we have recorded? Is she live? What is it? Someone will have to call her and tell her. Yes, she's there.
Ms. Garima, may I please request you to unmute your Zoom button? May I please request you to unmute your Zoom button?
Unmute.
You're not audible. May I please request you to unmute your Zoom button? Yeah, correct. No, you're not yet audible. It's still on mute.
You have to make the hostess to unmute her. No wonder Zoom stock has gone down. Nothing to do with Zoom, by the way.
Can we have her unmute from there? Ms. Garima, you're not audible, so may I please request you to unmute yourself?
Yeah.
I'm really sorry, but you're still not audible.
Prashant, the unmute maybe with you.
So, shall we move on to the next one?
It's just wait for one
Successful,
second.
we connect. Let's wait for some time.
Move on to the next one.
It's still mute, right? Showing us. Yeah, exactly. So that mutton needs to. Exactly.
Can you hear me, sir, now?
Yes, finally we can, and congratulations for your lovely award. We can all hear you.
Thank you so much for this, but I can't see you. I'm not able to see anything. I don't have the access.
Go ahead.
We can see you. Please go ahead. We are waiting to hear your lovely speech.
So thank you so much for honoring me with this award, Businessworld 30 Under 30. Although I could not be there at the event, but I'm really grateful, and it's going to work a little more harder in the future and to work more in my field of nutrition and dietetics.
All the best, Garima. Keep doing well.
Thank you so much, sir.
Congratulations, Garima. May the good work keep happening, keep shining, and keep inspiring others like the way you are doing. Congratulations.
Thank you so much, sir.
And the next BWHealthcareWorld.com 30 Under 30 award goes to we have Riya Golecha, founder and director, Kayakalp Trust, joining us virtually for this one. Can we please have Riya connected virtually?
Yes. Hi, everyone.
Yes, we can hear you. We can see you. Please go ahead. Congratulations.
Yeah, I'm dialing in from London. It's a Starbucks in London. I'm working out of here, so I'm really sorry about that. But very nice to meet you all and very honored to receive the award. I'm representing my firm called Kayakalp Trust, which is basically making healthcare more accessible using puppet shows that we deliver to audiences across the world in India and now in London. Our company helps underserved puppeteers living in New Delhi, and we're trying to make art a medium that helps communicate healthcare messages. So, thank you very much.
Congratulations, Riya. All the best.
Congratulations, Riya. All the best. Keep inspiring people like the way you are. What an inspiring story indeed.
Thank you.
We have the last two awards for the day, both of them virtually. Can we have the next winner, please? So we need the AV. We need the announcement, please. We can have the AV. Dr. Manan Arora, orthopedic surgeon and health educator, private practice. Unfortunately, due to network issues, he's unable to join us, but I believe we have an AV which we can play. So we don't have an AV, but we can just congratulate him for this lovely award. And the final award for BW Healthcare 30 Under 30 goes to Ms. Jay Relan, Investment Associate, The Council Ventures. Unfortunately, due to network issue, even he's unable to join. We don't have an AV, but we can congratulate him for this lovely award. And with that, I think it's an end to this lovely award ceremony. We have had some lovely winners. May I request Anurag sir to kindly...
Just want to say that Jay is the second youngest winner. He's 17. So we are happy that we have young people who are really making an impact and making an effort to make an impact getting recognized. And I'm sure it will enable other people and in some way inspire other people. I got out, I did my conversation with Miss Jolly, called my son who's the same age and said to him politely, Prasanna, you should be doing stuff You keep talking to me about ideas. When will you do it? And he's in class 10. He has other pressures of academics and, getting into a good college and all that. But congratulations and keep doing well. So especially happy about Jay and Anushka. They're 16 and 17. So please give them a big round of applause. Honestly, at 16, 17, only thing I could figure out is which is dairy milk and which is 5-star. Chocolate. Those are the things I could figure out. This is really high-fi stuff. So back for a group photo.
Yes, I'll let. May I please call upon stage all the winners of today for a lovely group photo. This is the moment of the day indeed, and may I please have you all on stage for the moment. I request all the winners to come up on stage, please. We are waiting for that moment of that lovely group photo. We want to see you all cheering and being happy, like the way you are. Let's have the winners one by one, please. And all the jury members as well, please. Requesting everyone to come and join us on stage for the most impactful group photo of the day. I request all the winners to come up on stage. We're waiting for the lovely group photo moment. Let's have everyone on stage, please. The stage is looking prettier than ever before. Wonderful. Do we have everyone on stage? The chairs are empty. Some of the winners, I believe, have left, so we have all the others who are here. So let's go ahead with a group photo with all of them. And loud cheers, ladies and gentlemen, as we cheer for them for this lovely group photo moment. Come on. Let's call it for a tighter frame.
Can we get 2 more chairs?
You're still getting the framing ready? Ladies and gentlemen, a team of inspiring people over here. Loud cheers, please, as we take the photos. This is the memory that we are all going to be taking away from this lovely event. Loving the smiles on all the faces. This is the future of tomorrow, isn't it? Primarily dominated by ladies. Come on, give it up for them. Women power, Nari Shakti Zindabad, ain't it? I believe some of you can be in the middle and then some of the other men can be over there so that the frame looks a lot more aesthetic. Thank you so much.